I have been here for 8,500 years on the shore of a gulf, throbbing like a heart in the Mediterranean. People from all over the world met at my harbors. They sang together, danced Zeybek and flourished commerce. The roots of philosophy are embedded in my land. Oldest stories of humanity, Iliad and Odyssey, traveled the world from here. Democracy, the secret of living in harmony, has thrived in my town squares. I went through poverty and countless disasters. Time and time again, I have managed to stay safe and cherish life anew. Traces of history and nature continue to breathe through me. With all its glory and warmth. Today, once again, I embrace life to the fullest. Witness new stories and unforgettable moments, together with my streets, my sea, and fertile land. Time for İzmir.
Dear participants, dear guests, and dear media representatives, good morning, good afternoon, and good evening from İzmir, from one of the most beautiful cities in the world. Welcome and thank you all for joining this virtual meeting of the İzmir World Pandemic Conference organized by İzmir Metropolitan Municipality with the cooperation of BUHASDER, Infectious Diseases Prevention Association, and KLİMİK, Turkish Society of Clinical Microbiology and Infectious Diseases. This is maybe the first conference that includes so many multidisciplinary speeches and such wide comprehensive content ever since the beginning of the COVID-19 pandemic has begun. So we are so proud to organize such an important event and to host so precious experts in our conference. The pandemic has changed many aspects of our lives and reminded us that the system we have established is no longer sustainable. With the pandemic, the processes of change in areas such as international relations, sociology, finance, economics, tourism, psychology, education, communication, and information management stand out as frequently discussed topics. In times of crisis, we must all together find a way to create some opportunities to implement more sustainable living models and management strategies. We are living in a world so uncertain and so unpredictable, but it is so important to stay hopeful for a better future. The way to protect our hopes is just going through science. With the İzmir World Pandemic Conference, which we held with the guidance of science, we aim to add new approaches to the literature and to make our hopes blossom again. Well, now, it's an honor to give the word to our distinguished opening speakers. Dear Professor Şükran Köse, the President of BUHASDER, Infectious Diseases Prevention Association. Dear Professor Alpay Azap, the President of KLİMİK, Turkish Society of Clinical Microbiology and Infectious Diseases. And dear Mr. Tunç Soyer, the Mayor of İzmir Metropolitan Municipality.
Hello dear participants. Welcome to İzmir World Pandemic Conference. I am Professor Şükran Köse. University of Health Sciences Tepecik Research and Educational Hospital, Department of Infectious Diseases and Clinical Microbiology and Immunology. The role of non-governmental organizations during pandemic and infectious diseases prevention association, BUHASDER. Non-governmental organizations, NGOs. Organizations which are independent of government involvement. Their support is very important during pandemic according to the type of NGO. NGOs can be related to health, economy, technical, environment, social, and go on. During the COVID-19 pandemic, NGOs were supported and are supporting to the people in their countries. Supports can be financial or aid in kind. In general, NGOs can help for providing food, medicine, and hygiene kits, maintaining critical health systems, spreading information and health messaging, supporting and getting funds for vulnerable communities, for like women and young people, people with disabilities, or older people, supporting education system, supporting farmers and villagers, setting up isolation and treatment centers, providing transport in lockdown, and improving livestock welfare. COVID-19 pandemic. It has affected whole world, and NGOs in each country support people in different ways. NGOs related to health provide information about the disease, publish scientific research related to cause of COVID-19 in the country or world, organizing conferences, webinars, physiological support for the patients, people in quarantine or isolation, and public during lockdowns. These NGOs include members working in different professions such as doctors, nurses, technicians, teachers, engineers, students, journalists, so go on. Besides treatment and taking care of the patients, members of NGOs join the studies, such as drug and vaccine development, surveillance, preventive measures. BUHASDER is a non-governmental organization that carries out preventive activities for the protection against common infectious diseases in society and conducts community screenings and training activities, providing medical care, social and physiological support, and assistance to people and groups who have a communicable diseases or pose a risk are the main aims of the association. BUHASDER has 54 representatives in different cities of Turkey. BUHASDER activities. 1. Active screening for communicable diseases, for hepatitis B and C, for brucellosis and HIV. 2. Trainings, for AIDS, for hygiene, for human papillomavirus, for hepatitis. 3. Public education activities in important days. World AIDS Day, World Hepatitis Day, World Hand Hygiene Day. 4. Scientific courses, biostatistics. 5. Scientific meetings, Tepecik Infection Days, BUHASDER Hepatitis Academia, HIV or AIDS course, Southeastern Intensive Care Unit Infection Symposium. 6. BUHASDER books, Transplant Infectious, Scientific Study Methodology, Infections in Old Age, Antibiotic Use in Elder, Infections in Intensive Care Unit, Homeland and Health Rabies in Anatolia in the Historical Process, Malaria in Anatolia in the Historical Process, Leprosy in Anatolia in the Historical Process. 56 Women Changing World. Nobel Prize winners. All income of this book will be used for the education of girls. Each Nobel winner biography was written by a woman scientist in Turkey. It is dedicated to Atatürk, who gives the all rights to the women first time in the world. Turkish women who played critical role in war of independence. All women who have pioneered in art and science and will pioneer into the future. And of course, all mothers. 7. Projects. Hygiene and protection against infectious diseases. Let's learn microbes, protect our health. Strengthening access to sexual reproductive health, family planning for Syrian refugees. Preparation of training sets for different segments of the society in order to reduce or prevent the spread of the diseases during and after the coronavirus pandemic. Collaborations. İzmir, branch of Ministry of Education. Asian Region, Chamber of Industry. İzmir, Union of Chambers of Craftsmen. Aims. to create dynamic educational materials that can be updated according to the course of the pandemic in the world and in Turkey, for people of different ages and working groups using different technological possibilities. Methods: preparing general education content, writing educational scenarios, and organizing content for different fields of study. Distance education models, video animations, mobile applications, printed material, and lots of documents were prepared. Project webpage www.covid19.yasar.edu.tr. Project is completed with a big success and dynamic, sustainable training platform that's presented to service of all occupational groups as well as the public.
Asla unutma, sevdiklerinin sağlığı da sana bağlı. Maske, mesafe, hijyen kurallarına uy, sadece kendine değil, sevdiklerine olan sorumluluklarını da yerine getir.
The foremost of these is a training on hygiene that we have carried out in primary schools, which is understood to be important during the pandemic. Since its establishment, our association has carried out and continues to carry out various activities, both for different segments of the public and for the scientific community. BUHASDER's activities are very important examples that show how well a non-governmental organization can contribute to the problems of the country. Trainings: hygiene, protective measures on sexually transmitted diseases in high school and universities, education of women about infectious diseases, educations on occupational disease, educations about infectious diseases from the villages to the cities. For these activities, we are collaborating with municipalities, branches of Ministry of Health, branches of Ministry of Education. Hand washing workshops. The activities are supported by TÜBİTAK and Dalan Chemical Industry. Last words. The importance of the training provided by BUHASDER for many years has been better understood during this pandemic and has contributed significantly to protection from COVID-19. It should not be forgotten that the lessons we will learn from the COVID-19 pandemic are also very important, as there may be similar epidemics in the coming years. We can prevent pandemics with knowledge. We can protect ourselves by knowledge. With personal protection measures, we can save others' lives. Thank you very much for listening.
Değerli katılımcılar, değerli izleyiciler, hepiniz İzmir Büyükşehir Belediyesi'nin ev sahipliğinde gerçekleşen Dünya Pandemi Kongresi'ne hoş geldiniz. Türk Klinik Mikrobiyoloji ve İnfeksiyon Hastalıkları Derneği olarak böylesine önemli bir konuda, böylesi güzel bir kongrenin organize edilmesi fikrini ortaya attıkları için ve bizi de bu keyifli çalışma programına, kongrenin organizasyonu programına dahil ettikleri için İzmir Büyükşehir Belediyesi'ne çok teşekkür ediyoruz. Başta Sayın Başkan Tunç Soyer olmak üzere belediyenin tüm çalışanlarına, ayrıca bu kongrenin hayata geçmesinde emeği olan herkese, bütün konuşmacılara ve tabii ki katılımlarınız için sizlere KLİMİK Derneği olarak teşekkür ediyoruz. Bu kongre çok önemli. Biz dernek olarak çok önemsiyoruz. Çünkü pandemiler sadece tıbbi süreçler değildir. Elbette biz kendi tıp kongrelerimizde pandeminin tıbbi boyutuyla ilgili çok konuşuyoruz. Toplantılar yapıyoruz. İşte bu hastalıkla nasıl mücadele edilebilir? Çok farklı boyutlarıyla her bir branştan ilgili uzman arkadaşlarımızla enine boyuna tartışıyoruz. Ancak pandemi dediğimiz şey sadece hastalık yönetiminden ve hastaların yönetiminden ibaret değil. Hepimizin son 1,5 yılda çok yakından yaşayarak gözlemlediği gibi pandemiler tıbbi süreçler olmanın yanı sıra bunların yarattığı çok ciddi ekonomik, sosyal, psikolojik boyutları olan süreçler. Ve bu nedenle de sadece tıbbi bir bakış açısıyla, sadece tıp perspektifinden, tıbbi çözümlerle üstesinden gelinebilecek sorunlar değil. Ekonomik, sosyal, psikolojik boyutlarını da mutlaka hesaba katıp bunlara yönelik bazı düzenlemeler, işte faaliyetler yaparak ancak üstesinden gelebileceğimiz, en azından etkilerini azaltabileceğimiz toplantılar. İşte İzmir Büyükşehir Belediyesi de bunun farkında olarak çok güzel bir düşünceyle konunun aslında tüm ilgililerine, yani sadece tıp alanından insanları değil, işte yöneticileri, hem genel yöneticileri hem mahalli idareleri hem de sağlık alanındaki yöneticileri dahil ederek konuyu bütün boyutlarıyla ele alan bir kongre hazırlama fikrini ortaya attığında biz de çok heyecanlandık. Çünkü biz de KLİMİK Derneği olarak salgının en başından beri bunu her platformda vurgulamaya çalışıyorduk. Bu sadece enfeksiyon hastalıkları uzmanlarının ya da sadece hekimlerin uğraşması gereken ve onların çözebileceği bir sorun değil. Pandemiler çok boyutlu ve toplum üzerinde yarattığı etkileri en aza indirebilmek için yöneticilerden başlayarak toplum içerisinde örgütlenmiş bütün demokratik kitle örgütlerinin, çalışan örgütlerinin, yerel yönetimlerin ve tabii en sonunda da vatandaşların el birliğiyle bir araya gelerek çözebileceği sorunlardır. O yüzden bu kongreyi biz böyle görüyoruz ve bu nedenle de çok önemsiyoruz. Bu kongrenin önemli olmasının bir diğer yanı da böyle bir işbirliği ortamı yaratmanın yanı sıra yanlış ve hatalı bilgilerle mücadele konusunda da bize önemli bir mevzi kazandıracağını düşünüyoruz bu kongrenin. Bu da aslında çok önemlidir. Yine hepimiz yaşayarak gördük son 1,5 yıl içerisinde. Pandemilerde, bu büyük salgınlarda yanlış, hatalı, eksik bilgiler çok fazla olur ve çok bunlara itibar edenler olur. Bunlar daha çok toplumda itibar görür ve yayılabilir. Ve bunun sonucunda da belki de hastalığın kendisinden çok daha fazla zarar verir topluma. Üstelik de bu hatalı bilgiler, eksik bilgiler, yanlış bilgiler yüzünden salgınla mücadele etmekte çok büyük zorluklarla karşılaşırız. Bu kongrede, Dünya Pandemi Kongresi'nde önümüzdeki günlerde ele alacağımız konularla bu hatalı bilgiler, yanlış veya eksik bilgilerle ilgili de düzeltmeler, en azından bunların doğrusu ne olduğu konusunda insanlara doğru mesajlar vermek konusunda da gayret göstereceğiz. Bu anlamda da bizim için bu kongre son derece önemli. Biz dernek olarak bu hatalı bilgilerin yayılmasını engellemek adına çok mücadele ettik ama yine bunun belli bir sınırı oluyor. Sonuçta ancak yine el birliğiyle idarecilerin, yerel yöneticilerin, sivil toplum örgütlerinin ve tabii ki vatandaşlarımızın. Konuşmamın bundan sonraki kısmında ben sizlere kısaca Türk Klinik, Mikrobiyoloji ve İnfeksiyon Hastalıkları Derneği olarak pandeminin başından itibaren neler yaptık bunları anlatmak istiyorum. Olabildiğince kısa ve sizleri sıkmadan anlatmaya gayret edeceğim. Bunu da lütfen bir övünme, böbürlenme gibi görmeyin. Biz neler yaptık şeklinde bir övme için değil. Bunu tamamen deneyim aktarımı olarak düşünmenizi istiyoruz. Biz pandeminin başından itibaren sonuçta yepyeni bir hastalıkla karşı karşıyaydı bütün dünya. Evet, daha önce karşılaştığımız bazı hastalıklara benzeyen bir hastalıktı ama sonuçta yeni bir virüsün sebep olduğu yeni bir hastalık ve dolayısıyla çok fazla bilgi birikiminin olmadığı bir hastalık. Bu nedenle de bizlerin hızlıca bilgi üretmemiz ve dünya genelinde üretilen bilgi, bu hastalıkla mücadele eden, hastalığın görüldüğü ülkelerdeki bilim insanlarının üretmiş oldukları bilgileri kısa ve yakından takip ederek olabilecek en kısa süre içerisinde bizim ülkemiz için bir bilgi birikimi oluşturmamız gerekiyordu. Dernek olarak biz bu konuda büyük bir çaba içerisine girdik. Elbette ki bu salgında sonuçta bir enfeksiyon hastalığı olduğu için en büyük görev enfeksiyon hastalıkları ve klinik mikrobiyoloji uzmanlarına düşüyordu. Sahada bizim arkadaşlarımız çok yoğun bir şekilde hastaların tanısı, tedavisi, hastalığın önlenmesi, başka insanlara bulaşmasının engellenmesiyle ilgili çok yoğun faaliyet içerisinde gecelerini gündüzlerine katarak adeta kendi canlarını, sağlıklarını tehlikeye atarak çalışırlarken biz de dernek olarak sahada çalışmakta olan bu arkadaşlarımıza olabilecek en hızlı ve en güvenilir bilgileri aktarmaya gayret ettik ki onlar da hastaları doğru bir şekilde yönetebilsinler, hastalığı doğru bir şekilde yönetebilsinler. Bir yandan tabii dernek olmamızın gerektirdiği onlara sosyal destek olmak adına da bazı faaliyetlerde bulunduk. Ama en çok bilimsel anlamda onları desteklemeye gayret ettiğimizi söyleyebilirim. Bu nedenle salgının en başından itibaren her hafta salı günleri bizim uzmanlarımıza, derneğimiz üyesi hekimlere yönelik olarak çevrim içi toplantılar yapmaya başladık. Bunu her salı hiç aksatmadan yaptık ve pandemiyle ilgili, hastalıkla ilgili ortaya çıkan en yeni, en güncel bilgileri üyelerimizle paylaşmaya gayret ettik. Böylelikle de ülkemiz insanlarının en doğru şekilde tedavilerinin yönetilmesini sağlamaya gayret ettik. İkinci olarak Sağlık Bakanlığı hastalığın başından itibaren tabii çok titiz bir şekilde çalışmalarını yürüttü. Daha pek çok ülkede bir bilimsel danışma kurulu yokken Sağlık Bakanlığı bir bilimsel danışma kurulu oluşturdu ve doğal olarak bu bilimsel danışma kurulunun içerisinde bizim derneğimizin üyesi bilim insanları da yer aldılar önemli sayıda. Biz bu dernek üyesi bilim insanı arkadaşlarımıza da dernek olarak olabildiğince destek vermeye çalıştık. Hem onların bilgilerinden, fikirlerinden faydalanarak hem biz de diğer üyelerimizin bilgilerini, fikirlerini onlara aktararak en doğru, en güncel kılavuzların hazırlanmasını, hastalığın tanısı, tedavisi ve yönetilmesiyle ilgili en doğru işlerin yapılabilmesini sağlamaya gayret ettik. Bu konuda da epeyce mesafe kat ettiğimizi, başarılı olduğumuzu düşünüyorum. Onun dışında hemen derneğimizin web sitesinde bir ayrı sekme oluşturduk, koronavirüs sekmesi. Burada da hem kendi dernek üyelerimize ama internet sitesi herkese açık olduğu için derneğimizin üyesi olmayan bütün hekimlere ama hastalıkla bir şekilde karşılaşacak olan, mücadele etmek zorunda kalan bütün hekimlere, hekim olmayan bütün sağlık çalışanlarına ve tabii ki halka yönelik bu konuda bilgilenmek isteyen, ki bilgilenmesi de gerekir halkın, ona da geleceğim birazdan. Bunlara yönelik bilgilerin yer aldığı bir ayrı sayfa oluşturduk dernek sitesinde. Bu sayfamızda çok fazla ilgi gördü. Biz burada yine en güncel haberleri, en güncel bilgileri gerek bilimsel literatür düzeyinde gerekse haber düzeyinde insanları ilgilendiren koronavirüsle ilgili haberleri en hızlı bir şekilde yayınlayarak duyurmaya gayret ettik. Tabii ki burada belli bir filtre uyguladık. Çünkü konuşmamın başında söylemeye çalıştığım gibi salgınlarda yanlış ve hatalı bilgiler çok kritik rol oynuyorlar. Salgının yönetilmesini çok zorlaştırıyorlar. O yüzden insanlara doğru ve güncel bilgiyi iletmek çok değerli oluyor. Biz bir misyon olarak da dernek olarak bu misyonu kendimize edindik ve web sitemizde hem hekimlere, hekim dışı sağlık çalışanlarına ve halkımıza en doğru bilgileri aktarmak için gayret ettik. Bu anlamda çok geniş bir ekip çalıştı. Bu bilgileri doğrulamak için ve zamanı da geçirmeden hastalarımıza, insanlarımıza duyurabilmek için. Buna Dünya Sağlık Örgütü toplantılarda da konuşulacak infodemi diyor. Yani pandemide çok fazla sayıda bir bilgi bombardımanıyla karşılaştık hepimiz. Hem bilimsel bilgi anlamında hem de yaşananlar, sosyal hayatta yaşananlar anlamında çok yoğun bir bilgi birikimi söz konusu oldu. Teknolojinin ulaştığı boyutu, işte sosyal medyanın etkisinde düşündüğünüz zaman bu bilgilerin çok geniş kitlelere çok hızlı yayıldığını da gördük. Ne yazık ki bu bilgiler içerisinde doğru olmayan, yanlış veya eksik olanlar da çok yayıldı ve insanları yanlış yönlendirdi. İşte biz bunu engellemek üzere de gerek sosyal medya hesaplarını, gerekse önemli web sitelerini takip ederek buralardaki hatalı veya eksik gördüğümüz bilgileri düzeltmek için kendi sitemizden doğrusunu yazarak bir faaliyette bulunduk. Bunların dışında sahada çalışan arkadaşlarımızın vermiş olduğu geri bildirimler çok çok önemliydi. Çünkü yeni bir hastalıkla karşı karşıyayız ve gerçekten bilinmeyen çok bu hastalıkla ilgili. Şimdi giderek azaldı ama başlangıçta en azından çok fazlaydı. Bu nedenle her bir arkadaşımızın, sahada bu hastalıkla uğraşan her bir arkadaşımızın fikirleri, yaşadıkları deneyimler çok büyük önem taşıyordu. Bu nedenle de bir toplantılar dizisi organize edip özellikle salgının birinci dalgası döneminde Türkiye'nin farklı bölgelerinde çalışmakta olan arkadaşlarımızın neler yaptığını, onların tecrübelerini dinleme fırsatını bulduk ve diğer başka şehirlerde, başka birimlerde çalışan arkadaşlarımız da bundan önemli ölçüde faydalanmış oldu. Tecrübe aktarımına yönelik bu toplantıların yanı sıra hastalıkla ilgili diğer uzmanlık alanlarında çalışmakta olan bilimsel derneklerle, uzmanlık dernekleriyle işbirliği içerisinde de çeşitli toplantılar düzenledik. Hem karşılıklı fikir alışverişinde bulunmak hem de bu konudaki bilgi birikimimizi karşılıklı paylaşarak daha da arttırabilmek için önemli faaliyetler oldu bu toplantılar. Örneğin halk sağlığı uzmanlarıyla, klinik mikrobiyoloji uzmanlarıyla, yoğun bakım uzmanlarıyla, göğüs hastalıkları uzmanlarıyla bir araya gelerek konunun farklı boyutlarını, insan sağlığı üzerindeki etkileri açısından ele alma fırsatını yakaladık. Ve sadece kendi aramızda bu şekilde toplantılar yapmakla da kalmadık. Uzmanlık dernekleri, bilimsel dernekler olarak bir araya gelip konunun farklı noktalarında gerekli bilgilendirmeyi yapmak üzere hem hekimlere yönelik hem insanlarımıza, vatandaşlarımıza yönelik bilimsel dokümanlar hazırlayıp bunları yine paylaşma şansı bulduk. Son olarak bahsetmek istediğimde dernek olarak pandeminin çok önemli noktalarında toplumda bir kafa karışıklığının oluştuğunu hissettiğimiz, gördüğümüz durumlarda bu kafa karışıklığını gidermek ve insanların bilimin doğrultusunda doğru bir davranış sergilemesine, doğru tutum almasını sağlayabilmek uyarılarda bulunduk. Bu uyarılarda bulunurken olabildiğince insanlarımızı paniğe sevk etmeden ama yapmaları gereken şeyleri de konunun ciddiyetini bütün boyutlarıyla anlatarak ama bilimsel temelde anlatarak onları neyi, neden, nasıl yapmaları gerektiği konusunda yönlendirmeye gayret ettik. Bu tabii çok ne kadar başardığımız ayrı bir tartışma konusudur. Sizlerin takdiridir tabii ki ama bizim gözlemlerimiz bu konuda önemli bir etkimiz olduğu yönünde. Tabii ki sadece bizler değil, diğer uzmanlık dernekleri, diğer bilimsel kuruluşlar ve tabii ki idarecilerin de bu konuda çok önemli katkıları oldu. Ama hep söylediğimiz gibi bu konuda herhangi bir hastalık konusunda belki de insanların en böyle dikkatle dinlemesi gereken ve kulak vermesi gereken, objektifliğinden şüpheye düşmemesi gereken kuruluşlar, bilimsel kuruluşlar, uzmanlık dernekleri oluyor. Bunun sorumluluğuyla bizler de işte gerek tedavi konusunda, gerek tanı testleri konusunda, gerek hastalıkla ilgili korunma önlemleri ve aşılar konusunda halkımızı bilgilendirecek önemli dokümanlar hazırladık. Bunları sosyal medya hesaplarımızdan, internet sitemizden paylaşmaya gayret ettik. Son olarak da bu aşılar konusunda soru cevap şeklinde insanları bilgilendirici bir paylaşımda bulunduk. Onların tamamen anlayabileceği şekilde, kesinlikle konunun ayrıntısına girmeden bilimsel temelli ama onları ayrıntılarda sıkmayacak kadar kafalarında oluşacak soru işaretlerini giderecek bir doküman hazırladık. Bunlarda nispeten başarılı olduğumuzu söyleyebiliriz. Bu son aşılama döneminde de bunu gördük. Çünkü bizim dernek olarak çok uzun yıllardır aslında mücadele ettiğimiz önemli konulardan birisi toplumda oluşan aşı tereddütü konusuydu. Bu aşı tereddütünün bu faaliyetler sayesinde çok azaldığını sevinerek görüyoruz. Halkımız aşı olmaya karşı büyük bir ilgi gösterdi ve büyük kuyruklar oluşuyor. Bizler de sağlık çalışanları olarak gece gündüz çalışarak olabilecek en kısa süre içerisinde olabilecek en fazla sayıda kişiyi aşılamaya gayret ediyoruz. Bundan 2 sene önce konuşsak böyle bir olayın olabileceğini, yani insanlarımızın bu kadar isteyerek gönüllü bir şekilde aşıya ilgi göstereceğini çok fazla açıkçası tahmin edemezdik. Bunda hem hastalığın tabii ki ciddi bir hastalık olmasının etkisi oldu ama hem de bu konuyla uğraşan uzmanlık derneklerinin, bu konuyla uğraşan diğer bilimsel kuruluşların katkısının çok büyük olduğunu düşünüyorum. Bütün bu çabalar sayesinde kazandığımız bir diğer önemli fayda da şu oldu. İnsanlarımız bilimin ne kadar önemli olduğunu, yani gündelik hayat içerisinde de aslında bilimin ne kadar önemli olduğunu da anlamış oldular diye düşünüyorum. Bu konuda yine bilimsel kurumların, sadece kendimizi söylemiyorum ama KLİMİK Derneği olarak biz bu konuda çok büyük gayret gösterdik. Diğer kuruluşlarla, diğer uzmanlık dernekleriyle birlikte basının, medyanın da bu konudaki olumlu ve sorumlu davranışı sayesinde televizyonlarda hep bilim insanları konuşur oldu. Hep o bilim insanlarının ne söylediği tartışılır oldu ve insanlarımız bilime kulak vermeye başladılar. Bu tek başına bu pandemiden bize kalan çok önemli bir faydadır, çok önemli bir avantajdır diye düşünüyoruz. Çünkü gerçekten hayatta karşımıza çıkan sorunları çözmekte bizim için en önemli araç bilimdir. Bunu biz tarihten de çok iyi biliyoruz. Kendi mesleksel pratiğimizden de bizler çok iyi biliyoruz. Dernek olarak, kurum olarak da biz bunun çok farkındayız elbette ama artık insanlarımız da bunu görmüş oldular. Hangi bir toplum eğer bilim dışında bir yöntemle sorunlarını çözmeye kalkarsa bunun sonu hep hüsran oluyor. Ve dolayısıyla artık bu çok herkes nezdinde kabul gören bir durum olduğu için son derece de mutluyuz. Bu pandemi kongresini de, Dünya Pandemi Kongresi'ni de yine bilimin ışığının insanların yolunu aydınlattığı bir fırsat olarak görüyoruz. İnsanların bilimin ne kadar önemli olduğunu anlaması konusunda da yine bir araç olacağını görüyoruz. O yüzden de tekrar bu pandemi kongresini düzenleyenlere ve siz değerli katılımcılara çok teşekkür ediyorum. KLİMİK Derneği adına herkese başarılı bir kongre diliyorum.
Esteemed participants, member of the media and press agencies participating in the coverage of the World Pandemic Conference, I send my greetings to you all to meet in Izmir on healthy and beautiful days. Today at the World Pandemic Conference, I'm experiencing the happiness and excitement of meeting with you. I'm very proud that İzmir Metropolitan Municipality is hosting the world's first conference in the field of the pandemic with the participation of experts from Turkey and the world. At the International Pandemic Conference organized by our municipality in cooperation with the Infectious Diseases Prevention Association and the Turkish Clinical Microbiology and Infectious Diseases Association, we will discuss all aspects of the COVID-19 pandemic, which has swept the world for over a year and affected our lives very negatively with different aspects. And of course, the valuable opinions that will emerge and will provide an important roadmap for all of us regarding what should be done and the measures to be taken against possible epidemics that we may encounter in the future. In this context, I would like to share the works carried out by İzmir Metropolitan Municipality since the beginning of the pandemic with its institutional capacity and our experiences in İzmir regarding the effects of the pandemic. İzmir Metropolitan Municipality became one of the institutions that developed the first response plan in Turkey regarding the COVID-19 pandemic. We started to take precautions regarding the pandemic before March 11, 2020, when the first case was seen in our country. In İzmir, which is one of the riskiest cities in Turkey in terms of the number of cases with a population of close to 4.5 million, our municipality has directed all its institutional and operational efforts to the field of combating the epidemic. In this direction, we have implemented a new management model called Crisis Municipality to instantly respond and find solutions to all health, economic, and social problems caused by the pandemic by carrying out a management model that has no example in Turkey. And we have revealed our working principles with a directive. With the Crisis Municipality Management Model, our municipality's financing, budget, and purchasing procedures have been fully adapted to the crisis period. We took decisions regarding savings measures, fast and complete procurement of services related to the pandemic, and similar decisions. We mobilized our financial and human resources to completely eliminate the effects of this period. This understanding of management has also been a source of inspiration for many local authorities in our country. Dear participants, the most fundamental result of all the crises we experienced is this: the only way to deal with these crises is common mind, acting together, cooperation, and solidarity. The effects of the global warming are increasing, and we are likely to experience many disasters and outbreaks in the short-coming periods. The most important way to combat all of these disasters, especially the pandemic and climate change, is to learn from these periods of crisis, to rebuild our cities in harmony with the nature, and to create resilient cities. In İzmir, we have started to act with this vision since the first day. We try to make İzmir a city that is in harmony with nature and resilient. As a member of the World Health Organization European Healthy Cities Network, we are honored to host the World Pandemic Conference in İzmir, a city which puts the health issue at the center of its vision. Within the concept of making İzmir a resistant city to pandemics, I sincerely believe that the opinions of valuable scientists and experts at this conference will enlighten the measures to be taken in possible outbreaks. I hope this conference will be followed with interest by physicians, experts, local administrators, non-governmental organizations, and all our citizens. I express my heartfelt gratitude to all those who have worked, contributed, and participated. Thank you all.
We thank very much to Ms. Köse, Mr. Azap, and Mr. Soyer for their opening speeches. In the process of getting used to the period that we call the new normal, we understood once again the importance of the local governments. So in the second session, we call Municipalities' Efforts Against the Pandemic, we'll welcome 5 important speakers to exchange pandemic experiences in the local. Dear Ekrem İmamoğlu, the Mayor of Istanbul Metropolitan Municipality. Dear Muhittin Böcek, the mayor of Antalya Metropolitan Municipality. Dear Fatma Şahin, the president of Union of Municipalities of Turkey and the mayor of Gaziantep Metropolitan Municipality. Dear Juan Fernando López Aguilar, the chair of European Parliament Committee on Civil Liberties, Justice and Home Affairs. And dear Dr. Zahid Badruddin, Cape Town Mayoral Committee member for Community Services and Health.
I would like to welcome and greet all participants with heartfelt feelings. I would like to also thank the organizers of this important conference. My dear friend Tunç Soyer, Mayor of İzmir Metropolitan Municipality, and distinguished authorities of the KLİMİK. After 1.5 years with COVID-19, we can easily tell the following: the world was caught off guard with this pandemic. This is actually surprising because the pandemic was not a surprise. On the contrary, it was something to which scientists had been drawing attention for quite a long time, for which they were recommending suggestions. It was a close and serious risk. Despite this, no country or institution was ready enough for it. It looks like the humanity has not yet completely internalized a governmental or political understanding based on science, and it has not yet applied such an understanding in a complete sense. With the pandemic, leaders in many places around the world have shown significant determination to walk on the path where scientists have been pointing, even though they were a little bit late. We have seen that such leaders have made very wrong decisions and so over time lost reputation and power. In situations where public authorities do not behave responsibly and seriously as the pandemic would require, the whole burden had to rest on the shoulders of healthcare professionals. We owe a lot to them. I hope that everyone has seen and understood that one of the most important elements of the struggle against this pandemic is to not make healthcare professionals feel burned out, unhappy, or helpless. As its name goes, pandemic is a global problem. But during this period, we have seen that the national dimension of the struggle against the pandemic is as important as, or maybe is more important than its global dimension. In order for a public health measure to be effectively implemented and for any social policy developed against the pandemic to be successful, they need to be first and foremost localized. If local particularities and sensitivities are not taken into account, if institutional and actual local dynamics are not taken into account, it is not possible to succeed in the fight against the pandemic. The closest managerial units to the public need should be given authority and empowered. In order to succeed against threats that the pandemic has made to human health, security and welfare, central and local authorities should stay outside all daily politics and power struggle and should have full cooperation. As Istanbul Metropolitan Municipality, we always paid attention to this, and we clung on to three concepts in order to correctly manage the multi-dimensional and complex process of this pandemic. These concepts are planning, coordination, and transparency. When you are fighting against the pandemic, you should plan all steps and possible outcomes together and manage the process so that all related institutions come together under maximum coordination. During this pandemic, where bad management costs human health and life, where each wrong decision can cause very serious outcomes, no one has the right to behave arbitrarily and say, I and only I know what is best. Transparency is key during all this process in order for right decisions to be taken. Transparency is a matter of life or death during this pandemic, and the getting away from it can prove to be as deadly as the virus itself. As a matter of fact, I cannot say that the extent to which we care about planning, coordination, and transparency, the sensitivity we have in that regards, is not shared by all the institutions of the state. Despite this, as local authorities, we have done very valuable work, not only in Istanbul, but in many parts of Turkey during the pandemic. We cannot even count one by one what we have done only Istanbul and what we are still doing. We have broken new ground in many areas, ranging from measures taken to facilitate the lives of healthcare workers to developing new and unique social solidarity models. I would like to particularly highlight one of them. We took the first step and buttoned up the first button in a correct manner. Right after the very first case of coronavirus was announced in our country on 11 March 2020, we set up the Scientific Advisory Board of Istanbul Metropolitan Municipality. However, just as it takes to have scientific competence and expertise to become a member of Scientific Advisory Board, it should be also a matter of expertise to elect the members of that board. That's why we first identified relevant professional chambers and associations which would be able to come up with solutions to the main problems, and we demanded formal representatives from them because it is professionals themselves who work in a certain field who know the most reputed people in that particular profession. Therefore, the composition of the Scientific Advisory Board of Istanbul Metropolitan Municipality was not determined by us, but rather by such institutions as the Turkish Medical Association, Chamber of Pharmacists, Association of Public Health, and the Turkish Society of Clinical Microbiology and Infectious Diseases. We made an effort to do everything in our power in the best way, following the suggestions of our Scientific Advisory Board, because that was the right thing to do. A Turkish proverb says, a misfortune is worth more than 1,000 pieces of advice. I hope that despite everything, the humanity has taken relevant lessons from the COVID-19 pandemic. I hope that the new normal of our world will be shaped by humanism, tolerance, and the solidarity in the light of science.
Hepinizi Antalya'mızdan sevgi ve saygıyla selamlıyorum. Öncelikle bu önemli buluşmayı organize ederek bizlere fikir alışverişi yapma imkanı sağlayan sevgili dostum İzmir Büyükşehir Belediye Başkanımız Tunç Soyer'e, Bulaşıcı Hastalıkları Önleme Derneği'ne ve Türk Klinik, Mikrobiyoloji ve İnfeksiyon Hastalıkları Derneği'ne teşekkür ediyorum. Neredeyse 2 yıldır bir hastalığın, bir virüsün dünyamızı ne hale getirdiğine hepimiz tanık olduk. İnsanlar hayatlarını kaybetti. Sağlık sektörü dünyanın birçok yerinde çökme noktasına geldi. İnsanların birbirleriyle ilişkileri mecburi olarak koptu. Ekonomiler ağır yaralandı. Türkiye'mizde elbette yaşanan bu küresel salgından payını aldı. Özellikle ülkemizin turizm başkenti olan Antalya'da da pandeminin ciddi etkilerini yaşadık. Vatandaşlarımızın ciddi bir bölümünü turizmden doğrudan ya da dolaylı olarak kazanç elde ediyor, seyahat yasakları, sokağa çıkma kısıtlamaları Antalya'mızı ciddi olarak etkiledi. Elbette böyle zamanlarda halkımızın güvenerek seçtiği insanlar olarak sorumluluk almak zorundayız. İlk olarak virüsün yayılmasını önleyici aksiyonlar almaya başladık. Bildiğiniz gibi halkımız maskeye ulaşmakta zorluk çekiyordu. Hemen Antalya Büyükşehir Belediyesi'nin dikim atölyelerini devreye soktuk ve seri maske üretimine başladık. Duraklarda, meydanlarda, kamu kurumlarında, pazarlarda dağıtımına başlayarak halkımızı maskesiz bırakmadık. Ardından yine belediyemiz bünyesinde hijyen ekibi oluşturduk. Tüm toplu taşıma araçları, kamusal alanlar, parklar, camiler gibi insanlarımızın bir araya geldiği yerler düzenli olarak dezenfekte edilmeye başlandı. Aynı şekilde kuaförler başta olmak üzere esnafımızın da iş yerlerinde ekiplerimizle ücretsiz hijyen çalışmaları yaptık. Vatandaşlarımızın çalışmadığı, evlerine ekmek götürmekte zorlandığı dönemde bir de su faturası yüzünden zorluk yaşanmasını istemedik. Özellikle insanlara sürekli temizliğin çok önemli olduğu söylenirken kimsenin borcundan dolayı suyunun kesilmesine izin vermedik. Ayrıca dayanışmayı büyütmek adına askıda fatura kampanyası başlattık. Veren el, alan eli görmeden hayırsever vatandaşlarımız zor durumda olan binlerce vatandaşımızın su faturasını ödedi. Elbette halkçı belediyecilik anlayışımız gereği sadece önleyici uygulamalarla hizmetlerimizi sınırlamadık. Her kesimden insanımıza ben sen öteki ayrımı yapmadan acil ve hayati ihtiyaçları 100.000'den fazla gıda kolisine ihtiyaç sahibi vatandaşlarımızı yine onları rencide etmeden kapılarına götürdük. Okullarından uzaktan kalan çocuklarımız için çözüm üretmek zorundaydık. Gereken cihaza sahip olmadığı için internete giremeyen, çevrimiçi derslerini takip edemeyen çocuklarımıza tablet ulaştırdık. Liselere ve üniversiteye giriş sınavına hazırlanan evlatlarımız için çevrimiçi sınavlar düzenledik. Evde bakım hizmetimizle yaşlı, engelli, ihtiyaç sahibi ve bakıma muhtaç hemşehrilerimizi yalnız bırakmadık. Tabii tüm bu hizmetleri verirken kendi çalışma arkadaşlarımızın da güvenliğini unutmadık. Esnek çalışma ve dönüşümlü çalışma sistemiyle hem hizmetlerin aksamamasını hem de personelimizin salgından korunmasını sağlamaya çalıştık. Şimdi kontrollü olarak normalleşme dönemine giriyoruz. Kısıtlamalar birer birer ortadan kalkıyor. Bence hem yerel yönetimler hem de vatandaşlar olarak üstümüze düşen görev daha da artıyor. Antalya Büyükşehir Belediyesi olarak bir daha kentimizin ve ülkemizin aynı zorlukları yaşamaması için gerekli tedbir ve düzenlemelere devam ediyoruz. Özellikle sahillerimiz de dahil olmak üzere insanların toplu olarak bulunduğu yerlerde sosyal mesafe düzenlemeleri, hijyen çalışmalarımızı hız kesmeden devam ediyor. Sosyal ve kültürel etkinliklerimizi de bu anlayışa uygun düzenliyoruz. Örneğin sahilde sosyal mesafeye uygun sinema gibi. Hemşehrilerimizin bir daha o zorlu günleri yaşamaması için yetkimiz çerçevesinde elimizden gelen her şeyi yapmak zorundayız. Çünkü toplum olarak hem ekonomik hem de psikolojik olarak çok zorlandığımız bir dönem geçirdik. Hastalık yüzünden hayatını kaybeden, yakınlarını kaybeden, işini kaybeden insanlarımız var. Bunlar kolay şeyler değil. Vatandaşlarımıza destek olmak zorundayız. Yerel yönetimler olarak aldığımız tedbirleri kesinlikle gevşetmememiz gerektiğini düşünüyorum. Halkımızın hafızasını da canlı tutmak önemli. Çünkü kontrolsüzce tüm önlemleri bırakırsak kısa sürede aynı şeyleri yeniden yaşamak zorunda kalabiliriz. Kendimizi hızla toplamak ve hayata devam edebilmek için fikir alışverişi yapmayı da çok önemsiyorum. Bu anlamda gerçekleştirdiğimiz bu toplantının çok faydalı olacağını düşünüyorum. Benim her zaman söylediğim bir söz var. Ben sen yok, biz varız. Biz birlikte yaparız. Bugün burada gerçekleştirdiğimizde tam olarak bu. Deneyimlerimizi, yaptığımız uygulamaları paylaşarak birbirimizden fikir almak, yerel yönetimlerde sorumluluk alan bizler için hemşehrilerimize sunduğumuz hizmetin kalitesini yükseltecektir. Hepinizi Türkiye'nin turizm başkenti Antalya'mızdan sevgiyle ve saygıyla selamlıyorum. Halkçı anlayışla çalışan tüm belediye başkanı dostlarıma kolaylıklar diliyorum. Beni dinlediğiniz için teşekkür ediyorum.
Dünya Pandemi Konferansı'nda sizlerle olmaktan duyduğum mutluluğu ifade etmek istiyorum. Organize eden herkese, kıymetli başkana, değerli katılımcıları sevgi ve saygıyla selamlıyorum. Gaziantep Büyükşehir Belediyesi olarak, başkan olarak biz ve arkadaşlarımız pandemiyle birlikte hem pandemide halkımızın en az zararla çıkması hem de pandemiden sonra kurulacak yeni dünyaya hazırlıklı olmak için büyük bir gayret gösterdik. İki bacaklı çalıştık. Özellikle pandemi sürecinde genel genelgelerin ete kemiğe bürünmesi, uygulamalarda şehrin koordine edilmesi açısından önemli bir çalışmaydı. Valimizle, Hıfzı Sıha Kurulu, pandemi kurullarıyla oradan çıkan kararlarda en büyük desteği lojistik olarak, Büyükşehir olarak biz verdik. Bir taraftan şehrin ekonomisini, sanayi şehrinin devam etmesini, bir taraftan da şehrin sağlıklı bir şekilde ekonomisini devam ettirmek için olağanüstü tedbirler aldık. Sanayimizde yaptığımız eğitim ve denetim çalışmalarıyla işçilerimizin sağlıklı ortamda üretim yapmalarını sağlayacak toplu alanlarda yemek olsun, burada toplu alanlarda yapılan çalışmalarda orada aile hekimleriyle, iş yeri hekimleriyle güzel bir çalışma yaptık ve bugün geldiğimiz noktada bu çalışmaların ne kadar önemli olduğunu görüyoruz. Bir taraftan da ihracatımızı yükselterek büyümeye devam ettik. Bir taraftan rakamlarımızı düşürerek sağlıklı ve güvenli bir şehir olma konusundaki iddiamızı devam ettirdik. Diğer taraftan tabii sağlıklı şehirde akıllı şehir çok önemliydi. Dijital uygulamalar çok önemliydi. Şehirde akıllı ulaşım en önemli başlıktı. Toplu taşımaları güvenli ve sağlıklı hale dönüştürmemiz gerekiyordu. 2017 yılında başlatmış olduğumuz güvenli ulaşım, akıllı ulaşım altyapısının yazılım ve donanım altyapısı ne kadar güçlü olduğunu göstermek açısından elimize büyük bir fırsat oldu. Bilişim AŞ'nin kendi hazırladığı yerli ve milli yazılımlarıyla HES kodu bağlantısını sağladık ve toplu taşımak için otobüse, tramvaya binmek için gelenlerin temaslı mı, şüpheli mi, pozitif mi olduğunu bakıp eğer bunların herhangi biri varsa da Gaziantep kartı iptal ettirerek otobüse binmesini engelledik. Bu da yine Türkiye'de yapılan önemli çalışmalardan bir tanesiydi. Örnek bir çalışma oldu. Diğer taraftan baktığımız zaman özellikle sağlık çalışanlarımız bu süreçte en çok yorulan, en çok fedakarlık gösteren grup oldu. Onlara müteşekkiriz. Onların ulaşım desteğinden istemiş oldukları daha sağlıklı şartlarda çalışmalarını etkileyecek sağlık paketlerine kadar kuvvetli bir çalışma yaptık. Hazırlamış olduğumuz tarım okulunda ürettiğimiz içinde C ve D vitamini, çinko ve magnezyum ağırlıklı olan bütün ürünlerimizi bir şifa paketi hazırlayarak onlara gönderdik. Bu ürünlerin içerisinde bir taraftan arabanın sarımsağı vardı, diğer taraftan İstahiye'nin biberi vardı. Bunların Oğuzeli'nin narı vardı. Bunlar bilim kurulundan daha çok tüketilmesi gereken gıdalar olarak bize söylenince biz kendi ürettiğimiz bu paketleri hemen sağlık çalışanlarımıza gönderdik. Koronalı hastaların evine şifa paketi olarak gönderdik. Diğer taraftan eğitim en çok etkilenen birimlerden biriydi. Çocuklarımızın güvenli şartlarda okul hayatına devam ettirmesi için güvenli okul projesini destekledik. Dağıttığımız maskeler, sıvı deterjanlar, dezenfekteler, stikerler okulun güvenli hale gelmesini sağladı. Bahçesinde ailelere ve çocuklara yaptığımız eğitimlerle bu sertifika programının altyapısını oluşturduk. Tabletler dağıttık. Yaklaşık 100.000 tableti şehrimizde bu işe alamayacak daha yoksul çocukların, yetim çocukların, mülteci çocukların buna ulaşmasını sağladık. Kırsal bölgede kiraladığımız uydularla internete ulaşmalarını sağladık. Eğitimden sağlığa baktığınız zaman ulaşımdan çevreye bu alanda çok önemli çalışmaları yaparken burası aynı zamanda bir şehir ekonomisi olarak bağladığınız zaman kültürel turizmin, gastronominin başkenti, lezzetin başkenti. Lokantalarımızda her yer fıstık gibi, her şey fıstık gibi bir sertifika programı açtık. Lokantalarımızın tek kullanımlıktan QR koda geçerek menülerin okutacağı, burada masa düzeninden buradaki hizmet veren garsonlarımızın eğitimine kadar önemli bir çalışma yaptık. Bu sertifikayı alan bütün lokantalarımızı biz yerinde ziyaret ettik. Her yer fıstık gibi, her şey fıstık gibi çalışmasını yerinde halkımızla paylaştık. Yeni trendde kültürel turizm nereye gidiyor? Deyince karavan turizminin yeni dönemde yükselen bir değer olduğunu, kanyon turizminin talep edildiğini, yerindelik, yerellik, deneyimlemenin ne kadar önemli olduğunu gördük. Bu alanda yaptığımız çalışmayla da şehrimizi pandemiden sonra ki yeni öncelikleri hazırladık. Ekonomiden ekolojiye nasıl geçeceğiz? Yeşil şehirleri nasıl çalıştıracağız? Akıllı şehirleri nasıl çalıştıracağız? Güvenli ve sağlıklı şehir nasıl olacağız? Bütün çalışmaları tamamladık. Halkımızla paylaştık. Bu konuda buna en hazır şehir olarak huzurlarınızdayız. Kongremizin hayırlı uğurlu olmasını diliyorum. Hazırlayan ve bu organizeyi yapan herkese çok teşekkür ediyorum. Bizi davet ettiğiniz için de hepinize selamlarımı, hürmetlerimi iletiyorum. Kongrenin başarılı geçmesini diliyor. Çıkan çıktıların da Türkiye Belediyeler Birliği Başkanı olarak da yakın takipçisi olacağımı ifade ediyor. Hepinizi sevgiyle, hürmetle selamlıyorum.
This is a message for the World Pandemic Congress. The municipality of İzmir, Turkey, actually the metropolitan municipality which is hosting this major event, this big thought and conversation on the evolution of the pandemic that we have been undergoing, actually suffering for more than 1 year now, a year and a half. And my message is delivered from the European Parliament here in Brussels. And my capacity to talk to you is that I am the chair of the Committee of Liberties, Justice and Home Affairs, which is the committee responsible for making laws on fundamental rights of the European citizens, civil liberties of the European citizens, free movement included, managing the external borders of the European Union while making policy and legislation on migration and asylum, judicial cooperation on criminal matters, criminal law in the making and security of the European citizens. But the point related to the pandemic that we have been suffering for all too long now is precisely that it has made a major impact on free movement, which is the most valuable asset of the European experience ever. Free movement. When you ask the European citizens what is the best of being European, they surely will point their finger on free movement, which is a fundamental right, the most valuable asset of the European experience is known by the name of Schengen. And the point is that through the pandemic, the member states of the European Union, which is an experienced rule by law, have resorted to an accumulation of emergency measures adopted unilaterally by member states in order to get control, get hold of the pandemic. And that has made a major impact on free movement. Actually, Schengen has been suspended. It's not that it has not been in good shape, it's that it's been severely damaged. That is why we members of the European Parliament, we're representing the citizens of the European Union in all, we're representing the citizens of 27 member states, we have asked the Commission time and again to come up with responses in order to restore a fully functional Schengen, on the conviction that there is no recovery from the social and economic impact that the pandemic has brought about to the European citizens' standards of life if there is no restoration of free movement. Without Schengen, without free movement, there will be no full recovery, nor social or economic recovery. But of course, we have to get things back on track while fighting the virus. Yes, it is a fact that fighting the virus takes science, takes pharmacological industry, and the vaccination process, which is underway according to the strategy that has been set forth by the European Commission. But it also takes caring about the rights and freedoms we cherish the most, including the right to free movement. That is why we asked the Commission to come with an initiative, and the Commission did late April. By late April, we had an urgent procedure in the making in the European Parliament, which means that according to a fast track, in the shortest time possible when it comes to lawmaking here in this European Parliament, we adopted our negotiating mandate, we endorsed the urgent procedure which has been put forward by the von der Leyen Commission, and we engaged in the so-called interinstitutional negotiation, which is called trialogue in the European parliamentary jargon. And through this tense round of negotiations, round the clock, we have not time to waste, not a minute to waste, engaging in serious negotiation with the Council, making the points of the mandate for negotiation of the European Parliament in order to restore Schengen and free movement. We cared about bringing legal certainty where there has been legal uncertainty, bring equal rights where there has been discrimination as a consequence of the emergency measures being imposed by the member states to the European citizens, preventing free movement from happening. That is why we insisted that once we have a so-called EU COVID digital certificate, the European citizens will be granted free movement through the borders of the European Union member states. We're talking of a regulation, which means that it's a piece of legislation which is binding for all of the member states, effective as July the 1st, so in time to meet the summer 2021 and make the difference as the summer 2020, which was a total catastrophe precisely as a consequence of the crumbling down of free movement and the suspension of Schengen. We made sure that once you are given the certificate, then you are given access to free movement. And exceptional measures which are to take place according to the sanitary needs or the needs of public health, which is to be secured by the member states, shall have to be exceptional in their nature, limited in the scope, time framed. So there has to be a duration limited as for the outset and as for the expiration of those measures. And of course they have to be consistent, not only with the principles of necessity, they have to be necessary, and proportionality, they have to be proportionate to the ends that they are supposed to meet, but they also have to be communicated in due time, in a comprehensible, timely and complete manner to the Commission, which is to report to the European Parliament so that we can exert our scrutiny on the Commission and to the European citizens which are to be affected with an anticipation. To the Commission, 48 hours, and to the citizens at least of 24 hours in advance. We also made sure that the Commission would commit itself to make sure that the economic discrimination that has been imposed as a consequence of the restrictions to the free movement, requirements of PCRs, requirement of antigen tests, which have been costly in many countries, are to be reduced, are to be tackled. That is why the Commission has committed itself to mobilize 35 million euros for antigen tests and at least 100 million euros to lower the cost of the PCRs. But as the vaccination process is making progress, the PCR or antigen test or the serological test, which proves that you have undergone the contagion, the virus, but you have recovered, will be statistically less frequent insofar as vaccination will be the predominant choice to be certified. And that is why we call it a EU COVID certificate, a digital COVID certificate, because it's to be granted, gratuitous, free of charge, automatically by the health authorities of every member state or the sub-state levels, the Länder in Germany or the autonomous communities in Spain or the regions in Belgium. They are the ones which are responsible for issuing the certificate, which is to be valid with a unitary content, homogeneous in its format, with three choices: vaccination certificate, PCR or antigen tests, or a serological test that you have recovered from the illness, automatically issued for all the European citizens, free of charge, so that they can get back on the move and make the difference in summer 2020. But also, this certificate is to be consistent with the European standard of data protection, which is the highest in the world, which means that the data are to be minimalized and data are not to travel with the bearer of the certificate. Human beings are to freely move, are to move freely. The European citizens are to be back on track to Schengen, fully restored, but the data will not travel with the European citizens because the data will be stored only by the health authority which is issuing the certificate, not by the country of destination of the traveler. And besides, not only the minimalization of data, they have to be secured according to the principles and standards of the EU data protection law. Those were the concerns of the European Parliament while engaging in a tough negotiation with the Council, which went round the clock for 2 or 3 weeks, so that we could actually deliver and make it in time. By the end of May, we had completed our legislative work. By June the 8th, we had it adopted in a final vote in the European Parliament. Next Monday, we proceeded to the so-called solemn signature. Me as rapporteur, President von der Leyen, President Sassoli of the European Parliament, Antonio Costa representing the European Council, putting their signatures on the final document so that it'll enter into force and be binding for all the 27 member states July the 1st, making the difference summer 2021. And a final word. We as legislators, we have been asked many times, what if the vaccination is not everlasting in time? What if the vaccination proves that it has to be renewed in a certain period of time? What if this vaccination is not that as effective as other vaccinations? The vaccinations which are acknowledged in the certificate are the ones recognized by the European Medicament Agency or by the emergency list of the World Health Organization, which is to give also legal certainty to third country nationals coming to the European Union, which are to be granted the same free movement on equal rights as the European citizens, so far as their vaccination or certificates are compatible with the ones which are required according to this regulation by the member states, which is directly binding for all of the member states. But the answer to those scientific questions that have been addressed to us is that our role is not the role of scientists. Our role is to provide legal certainty where there was legal uncertainty and equal rights where there was discrimination among European citizens. Our role, in short, is making laws, not coming up with scientific answers. That is your task. That is the task of this gathering of yours in Izmir, this World Pandemic Congress, which I salute. That is the world of the scientific community, the pharmacological community, to come up with answers and to follow up. This certificate is to be valid for 1 year. There is a sunset clause. In 1 year, we will have time to redress the situation, we will have time to reassess, and we will have time, if needed, to prolong the effectiveness of this legal piece of legislation, this regulation. But we will be awaiting for the further steps and the developments and the advances which are to be made by the scientific community. That is why I thank you as a lawmaker here in the European Parliament of the opportunity to address you. And we will be appreciating every single step you make in the direction of overcoming this world pandemic of COVID-19 for good. Thank you all.
Good day. My name is Dr. Zaid Badruddin and I am the Mayoral Committee Member for Community Services and Health in the City of Cape Town. It is a great pleasure to be able to represent the Mother City at this first International Pandemic Conference. Today is day 463 of the lockdown in South Africa. We are currently under lockdown level 3, which enforces a curfew from 10 p.m. until 4 a.m., a limitation on the number of people gathering inside and outside, set at 50 and 100 people respectively. In addition to this, all non-essential businesses are to close at 9 p.m. There are other number of regulations that have not only shut our city's doors to the world, but has had real impacts on the lives and livelihoods of all of our residents in the city of Cape Town. On the 11th of March 2020, the Provincial Department of Health confirmed the first case of coronavirus in our city. The patient, a 36-year-old male, presenting himself to a primary healthcare facility after experiencing flu-like symptoms upon returning from Europe. The confirmed diagnosis marked the start of the pandemic for the residents of Cape Town. We were faced with numerous decisions in an environment filled with uncertainty, an environment at that stage with little scientific data to guide an informed, evidence-based response. Information about the virus also was limited at that stage. South Africa faces a quadruple burden of disease, which includes the HIV/AIDS epidemic, along with a high burden of tuberculosis, high maternal and child mortality, high levels of violence and injuries, and a growing burden of non-communicable diseases. It was absolutely necessary for us as a city, guided by the national and provincial guidelines, to act quickly and in the best interest of our residents with a view to protect our economy, our ability to deliver basic services, and also our ability to increase our service provision to vulnerable communities. As a caring and responsive government, we acted quickly. And on the 18th of March 2020, just 7 days after our first confirmed coronavirus case, all public facilities were closed in order to introduce an immediate measure to limit the spread of the virus. Following on from our rapid response, other municipalities implemented similar measures until finally the implementation of the National Disaster Regulations on the 27th of March 2020, mandating at that stage a 3-week lockdown period. Cape Town has experienced 2 waves of COVID-19 infections, and we have just entered our 3rd wave of infections as of the 14th of June 2021. The first wave began in April 2020 and lasted until mid-September, with a second, more severe wave starting in November 2020 and ending around February 2021. there have been just over 190,000 reported COVID-19 infections in the metro, with 7,800 fatalities. At the beginning of the third wave, we are experiencing about 4,500 active cases at the moment. We are also now entering a period of rapid increase of active cases. Our metro is divided into sub-districts. Some health sub-districts like KLİMİK and Mitchell's Plain had a much greater infection rate in the first wave than the second wave. These communities are some of our most impoverished areas in the city and lack strict adherence to quarantine and non-pharmaceutical intervention measures. The sub-districts are also high-density, low-income suburbs and need to continue to be economically active to survive. South Africa catered for implementing a flexible lockdown level plan based on the COVID-19 surveillance picture. Municipalities are required to enforce these regulations on the lowest community level that is closest to our residents. Generally, these levels adjust the amount of population movement, gatherings, and also economic activities which are allowed. As infection risk increases, stricter regulations come into enforcement. This dynamic approach is successful, with the proof being that the second wave subsided much quicker than the first following increased lockdown levels. The regulations make it mandatory that non-pharmaceutical interventions are practiced constantly through all levels and make non-compliance a criminal act. The City of Cape Town government has a multi-departmental approach to enforce these regulations and to support the community in adhering to them. The city implemented a data-driven response to aid residents effectively and also invested in developing data tools and dashboards which allowed for a constant stream of visible and value-adding outputs to assist with the decision-making. We have certainly seen that the value of making data visible and accessible to the public is essential in driving collective understanding as well as action. The development of public-facing dashboards was a vital aspect of the city's drought response in 2016 and 2017, and we know from experience that shared data will aid us with the pandemic. Over the pandemic period, we have relied on quantitative analysts within line departments who can reason critically and work closely with operational decision makers. We have learned how to use existing data creatively, beyond just the purpose it was originally intended to support. Existing data now guides decisions we've never thought would have needed to make. For example, we have used existing socioeconomic and demographic data sets combined with the burden of disease and comorbidity data and spatial data sets indicating densities and housing typologies to create a vulnerability viewer. This viewer enables the city to view which communities have a heightened risk profile relating to COVID-19. We also had to understand the coronavirus in terms of resilience. We worked towards understanding the holistic effects of the coronavirus and responded to it as an acute shock. We defined the disease as a shock because of its nature as a sudden sharp event threatening our city. This government and broader society were ill-prepared at the start to respond when it was needed at the beginning. The shock has been compounded by existing chronic stresses that weaken the city's fabric on a day-to-day or cyclical basis. The health, social, and economic impacts of the pandemic will continue to interact with the existing multidimensional risks in communities, particularly vulnerable communities, reducing resilience to them. Broadly, the types of risks prevalent in Cape Town's most vulnerable communities include, in terms of health, maternal and child disease, infectious diseases like TB and HIV, non-communicable diseases as well, mostly chronic, as well as a growing caseload of mental disorders, including depression and anxiety. Our economic risks include insecure livelihoods, poverty and unemployment, Social risks include crime, gender-based violence, civil unrest, substance abuse. Environmental risks include floods, fires, and extreme weather, and infrastructurally access to basic services. Building resilience requires viewing the city holistically, understanding the interdependencies between the COVID-19 and existing stresses to adapt and transform in the face of this pandemic. Cross-functional departmental teams that draw on a range of skills and capacities have proven instrumental in allowing the city to leverage its full capacity to prevent COVID-19 spread and, more recently, to support our vaccine program. We have found that crowding and bringing together strategic planning, project management, data science, and community engagement, as well as communication capacities, has provided our City Health Department with a much enhanced human resource base to plan and ramp up capacity during the pandemic. It has been critical to ensuring the health system remains in a state of readiness, and there is a strong emphasis on ensuring it is more resilient at withstanding stresses and shocks over the long term. Resources are now allocated to strengthen continuous surveillance that is critical to identifying infections before they become outbreaks and limit disease spread. How we manage our facilities are critical to safeguarding the city systems. We focused on building strong stakeholder relations and collaboration with all industries. To secure the health of healthcare workers, the city and province launched what we call the Red Dot taxis that transported healthcare staff safely to and from work. We also dispersed funeral bookings throughout the week to unblock bottlenecks and assisted with maintaining social distancing and public movement as a result thereof. The fatality chain was placed under immense pressures during the peaks of the infection waves. The City of Cape Town collaborated with the Department of Home Affairs to also streamline the issuing of death certificates to allow for a quicker burial process. As a caring city, it is our responsibility to ensure dignified burials to all of our residents. And as a city, we are mandated to deliver essential basic services, and we made provisions to ensure the continuation of service under extreme pressures. The Disaster Risk Management Department implemented the Disaster Coordination Task Team meetings. These planned the continued delivery of essential services that included solid waste management, electricity, water, sanitation, and safety. Like many cities worldwide, Cape Town struggles with the phenomenon of urbanization that sees thousands of people moving into the metro each month. Informal settlements in the city expanded and saw the formation of more than 53 unplanned informal settlements, or as we know it, townships. Our Human Settlement Department implemented basic services to the townships, intending to maintain a healthy environment that suppresses the transmission of the virus. The Informal Settlements Unit maintained and enhanced services in informal settlements that house approximately 200,000 households, delivered temporary services to new unserved informal settlements with 14,000 homes. Many communities and specific people within Cape Town face several practical barriers to accessing credible information on the vaccine program, registering for the vaccine, and also accessing healthcare facilities to receive the vaccination. These barriers will contribute to many persons perceiving the act of getting vaccinated as either too confusing or too risky or too inconvenient. The social and economic isolation of many communities, particularly those in our informal settlements and living on the city's margins, mean that they are cut off from accessing health information and health care and have little to no relationship or trust with the city. In addition, Cape Town has many populations living on the margins of our societies, such as those struggling with drug addiction, those who are undocumented migrants, and those who have previously or currently engaged in illegal or antisocial activities. bringing information, registration, and vaccination as close to these communities and people groups as possible will go a long way towards overcoming these barriers and expanding the vaccine program's reach into the most vulnerable communities of our city. There has been a substantial volunteer movement since the pandemic began as well, focusing on awareness activities, mask and sanitizer distribution, as well as food aid through our humanitarian programs. These same networks of volunteers will be called upon to support the vaccine program awareness and empowered to do so with frequently asked question documents and communication materials which they can share with their networks. As a caring city government, we have realized the importance of leveraging infrastructure and already existing networks within communities, which can support effective communication and coordination of resources, such as community networks and existing communication channels, such as neighborhood watches, community-based organizations, faith-based organizations as well. Our city is now focused on registering our elderly, above 60 population for the vaccinations. We are finishing off the vaccination program of our healthcare workers, and we are committed to sustaining a structured interface at the local level between public officials, private sector, and civil society actors to effectively mobilize community resources in support of the vaccine program. A staggered approach to the vaccine rollout has been adopted by our national government as well, with 3 phases, each phase targeting a different section of the population based on risk. The city is committed to contributing to the national goal of attaining herd immunity. For this goal to be realized in Cape Town, there needs to be a system in place which supports the vaccination of as many people as quickly as possible in response to current and future strains of the coronavirus in a manner that prioritizes the most vulnerable and results in as little virus spread as possible. Within the Western Cape government and the city have sought to co-create a vaccine strategy for phase 2 and 3 of the vaccine rollout and a governance structure that will give effect to this strategy. The city has partnered with the Western Cape government to leverage our different institutional resources and relationships so that together the 2 spheres of government can ensure the vaccine program is a success. The rollout in the Western Cape is under the stewardship of the Western Cape Department of Health. A multi-stakeholder approach is being undertaken to ensure efficient distribution of vaccines to all persons within the Western Cape, whether they be private or public healthcare users. The city is supporting this rollout in the public sector by aiding in logistics planning, utilization of our public facilities, and also forming part of the vaccination teams throughout City Health. The distribution of vaccines will, through a combination of small, medium, and large facilities, ensure that access is available to all of our residents. Vaccinations will be free of charge to all South Africans. The city is also engaging in collaborative communication and social mobilization campaigns, ensuring that the message of vaccination reaches all Cape Townians, even the most vulnerable. We have seen that in order to cope with the COVID-19 pandemic and any future pandemic, the following aspects are key for any local authorities to consider in order to protect services and to prevent as well as fight potential pandemics in the future. Firstly, the development of a resilient practice approach and policies informed by acute stresses. Secondly, modernization and utilization of modern and existing data sets. Thirdly, flexible and agile work team focused on coordination and implementation of basic and relief humanitarian services. Fourthly, enhanced strategic communications focusing on the provision of lives and livelihoods. And fifthly, public participation and shared understanding of the threats and the shocks which are faced. Local governments must be responsive and able to adjust quickly and appropriately to the specific nature of any threat. This is done through coordinated interventions on both a political and an administrative level. The City of Cape Town is prepared to do just that, We will continue to prioritize the health of our residents whilst looking towards the future in which a new normal guides our everyday interactions. I want to thank you and the organizers for the opportunity to present the City of Cape Town's efforts to protect our city and to use these fundamental learnings should the need arise in the future to do so once again. Thank you.
We thank very much Mr. İmamoğlu, Mr. Böcek, Ms. Şahin, Mr. Aguiar and Mr. Badruddin for their speeches. Many activities had to be cancelled or postponed due to the restriction caused by COVID-19. These activities that couldn't be realized created difficulties for people, for the private sector and also for the governments. So we are going through our third session, which will discuss the situation of tourism, culture and gastronomy during the pandemic. At the session, we'll be with dear Firuz Bağlıkaya, the president of TÜRSAP, Turkish Travel Agencies, dear Max Kownatski, the CEO of Sun Express, dear Norbert Fiebing, the president of German Travel Agencies Union, dear Terry Dale, the president of United States Tour Operators Association, dear Michele Rumiz, the travel director of Slow Food, dear Sunil Kumar, the president of United Federation of Travel Agents Associations.
Kıymetli meslektaşlarım, saygıdeğer katılımcılar, değerli basın mensupları. Dünyanın yakın tarihte yaşamadığı olağanüstü bir dönemi yaşıyoruz. Covid-19 virüsünün tüm dünyayı etkisi altına alarak pandemiye dönüşmesi, insanlığı büyük bir sınavla karşı karşıya bıraktı. Son 2 yıldır mücadele ettiğimiz pandemi süreci, dünya genelinde sağlıktan ekonomiye, sosyal hayattan tüketim alışkanlıklarına kadar hayatımızın her alanında çok derin izler bıraktı. İş yapış modellerinden tüketici beklentilerine kadar birçok alanda köklü değişimlere sebep oldu. Bu süreçte turizm tüm dünyada tarihinde gördüğü en büyük daralmayı yaşadı. 2019 yılında büyük bir ivme yakalayarak 1,4 milyara ulaşan uluslararası seyahat sayısı ile tarihin en yüksek seviyesi yakalanmıştı. Uluslararası turizm gelirleri ise 1,5 trilyon dolarlık bir büyüklüğe ulaşmıştı. Ancak pandeminin etkisiyle 2020 yılında uluslararası turizm hareketlerinde %73 oranında bir daralma yaşandı. Ve geçen yıl uluslararası seyahat sayısı 1 milyardan fazla bir kayıpla yaklaşık 400 milyon seviyesine geriledi. Türkiye'de bu daralmadan payını aldı. 2020 yılında toplam ziyaretçi sayısında %69, turizm gelirlerinde %65 azalma yaşadık. Ancak bu rakamlara bakıp aldanmamak lazım. Zira bu rakamların ifade ettiğinden çok daha büyük bir zarar söz konusu. Kitle turizmi ile ilgili hemen hemen sadece Antalya bölgesindeki sayılı otelde ve 1-2 pazar kapsamında gerçekleşen turizm hareketine ait bu rakamlar, turizmin gelişmekte olduğu bölgelerimizde ve kitle turizmi dışındaki alanlarda yaşanan felaketi ortaya koymaktan oldukça uzak. Rakamlarla ifade edilen durum, pandeminin sektörümüze verdiği hasarın görünen tarafını oluşturuyor. Maalesef işin görünmeyen tarafında iç açıcı olmayan başka bir tablo daha var. Turizm çalışanlarının yaşadığı işsizlik, turizmcilerin içine düştüğü ekonomik darboğaz, sektörün yüz yüze kaldığı borçlanma ve ayakta kalma çabası ile tüketici nezdinde oluşan tedirginlik ve güven kaybı bu süreçte yaşanan diğer olumsuzluklar. Bu büyük felaketin etkilerini azaltmak, akabinde ortadan kaldırmak için TÜRSAP olarak biz ve sektörün tüm unsurları el birliği, güç birliğiyle çalışıyoruz. Bu sektörü bugünlere getiren gücün biz olduğumuzun farkında olarak yeniden ayağa kaldırma sorumluluğunu da taşıyoruz. Değerli konuklar, pandemi nedeniyle tüketici beklentileri ve trendlerinde de birçok değişim yaşandı. Dünya ekonomisinde tedarik zincirlerinin bozulması, uluslararası seyahatlerin uzun bir süre askıya alınması, ülkelerin kendi içine kapanması, turizmdeki mevcut ezberleri alt üst etti. Pandemi özellikle ilk döneminde seyahat etmek bir yana insanların evlerinden dışarı dahi çıkamadığı bir süreci beraberinde getirdi. Pandemi döneminde hizmet anlayışı ve uygulamaları köklü bir şekilde değişti. Sosyal mesafe kavramı gündelik yaşamın bir parçası oldu. Hijyen ve güvenlik tüketici tercihlerini belirleyen ana unsurlar olurken butik destinasyonlar ve tesisler bu süreçte öne çıktı. Önümüzdeki dönemde özgün küçük tesislerin öne çıkacağı, daha küçük gruplar halinde seyahat edileceğini öngörüyoruz. Bu sayede ülkemiz turizminde de bir değişim gerçekleşecek ve bugüne kadar turizmden yeterince pay almamış bölgelerimizin öne çıkma şansı doğacaktır. Bizim gibi incoming turizm esaslı ülkelerde uluslararası seyahat kısıtlamaları nedeniyle boşalan kapasiteyi dolduran kaynağın iç turizm olduğu, iç turizm pazarına daha çok önem verilmesi gerektiği de bir kez daha görüldü. Pandemi, dijital mecraları her sektörde öne çıkarırken turizm de bundan payını aldı. Bu nedenle tatillerini ertelemek zorunda kalan her yaş grubundan insan pandemi sonrası döneme dair tatil planlarını internet üzerinden yaptıkları arama ve araştırmalarla şekillendirmeye başladı. Satın alma kararlarında dijital mecralar üzerinden yapılan paylaşımların etkisinde büyük bir artış yaşandı. Kendilerini doğru konumlandıran sanal gerçeklik, artırılmış gerçeklik gibi yeni teknolojileri kullanarak tüketicilere ulaşan, ürün ve destinasyonlarını tanıtanlar yakın gelecekte daha da öne çıkacaktır. Bu yeni dönemde sürdürülebilir ve sorumlu turizm anlayışı çerçevesinde özgün, yerel, doğal, tarihi ve kültürel olanı korumak yönünde gelişen ciddi bir eğilim de dikkat çekiyor. Dünyamızı koruma güdüsü daha da arttı. Küresel seyahat pazarında seyahatlerin ana kolunu halen kitle turizmi oluştursa da çevre duyarlılığı ön planda olan sürdürülebilir turizm anlayışına sahip tüketici kitlesi de giderek artıyor. Saygıdeğer katılımcılar, Türkiye kendisini turizmde kısa sürede üst sıralara taşıyan avantajları ile yeni dönemde de turizm dünyasının önemli aktörü olmaya devam edecektir. Bu kez sadece incoming turizmde değil, dünya turizminin geleceğinde çok önemli bir yer tutan kongre, sağlık, gastronomi, macera ve şehir turizmi gibi alanlarda da sahip olduğumuz potansiyeli harekete geçirmeliyiz. Bu dönemde her bölgemizin hak ettiği payı alacağı bir turizm modelini geliştirmeliyiz. Özellikle ülkemiz turizminin en köklü destinasyonlarından olan Ege bölgesi ve İzmir, doğası, kültürel ve tarihi değerleri, kıyı turizmi olanakları, gastronomi zenginliği, inanç, sağlık ve MICE turizmi altyapısıyla yeni dönemde turizm açısından önemli avantajlara sahip. Bu süreçte en çok zarar gören turizm segmentlerinin başında gelen kruvazyer turizminde İzmir'in öne çıkması için yapılan çalışmaların devam etmesi, sadece bir uğrak limanı olmaktan ziyade hub olması sağlanmalıdır. Değerli konuklar, turizmde doğru zamanda doğru strateji ve politikalar üreterek uygulamak geldiğimiz noktada artık hayati önem taşıyor. Tüketici tercihlerinde devreye giren yeni dinamikleri iyi analiz edip buna göre hareket etmek gerekiyor. Bu noktada büyük veri, bulut sistemleri, yapay zeka, robotik süreçler hayatımızın vazgeçilmezleri olmaya başladı. Big Data olarak adlandırılan uçsuz bucaksız bir veri denizine sahibiz. Bu veri denizinin içinde kaybolmamak için dijitalleşmenin getirdiği olanaklarla elde edilen verileri doğru biçimde analiz etmek, anlamlı bir bütün haline getirerek bu çerçevede stratejiler oluşturmak büyük önem arz ediyor. TÜRSAP olarak pandemi döneminde gerek yurt içinde gerekse yurt dışında diyaloğa ve bilgi alışverişine son derece önem verdik ve buna uygun adımlar atarak çeşitli çalışmalar gerçekleştirdik. Gerçekleştirmeye de devam ediyoruz. Yurt içinde kamu kesimiyle olduğu gibi sektör paydaşlarıyla da ortak hareket etme çabası içinde olduk. Yurt dışında muadil kuruluşlarla bu dönemde de diyaloğa özen gösterdik. Online toplantılarla görüş alışverişinde bulunduk. TÜRSAP Fuarcılık ve İSFAŞ işbirliğinde bir ilki gerçekleştirdik. Şubat ayında online olarak gerçekleştirdiğimiz 14. Travel Turkey fuarımızla sektörümüze bu zorlu dönemde moral verdik. Geleceğe dair planlama ve projeksiyonlarını yapmaları için çok önemli bir zemin oluşturduk. Travel Turkey fuarının yanı sıra 1. Uluslararası TÜRSAP Turizm Zirvesi'ni düzenleyerek sektörün sorunları ve beklentilerini ortaya koymaya, yeni döneme yönelik ipuçlarını yakalamaya çalıştık. Saygıdeğer katılımcılar, önümüzdeki dönemde gerek sektörün, gerek kamunun ortak akıl ve vizyonla hareket etmesi büyük önem taşıyor. Ancak bu perspektifle hareket ederek turizmin aldığı derin yaraları sarmayı başarabiliriz. Dolayısıyla bu yöndeki gayret ve çalışmalarımızı artırarak devam ettirmeye kararlıyız. Yeni dönem şeffaflığın, bilgi kirliliğinin önlenebilmesi için medya ilişkilerinin eskisinden daha da önem kazandığı bir dönem olacak. Yeni döneme hazırlanırken bu gerçeklerin gözden kaçırılmadan hareket edilmesi son derece önemli. Önümüzdeki dönemde hem Türkiye hem Ege ve İzmir turizmi açısından önemli fırsatların olduğunu düşünüyorum. Ege ve İzmir'in turizmdeki yolculuğunda TÜRSAP olarak her zaman yanında olacağız ve üzerimize düşeni yerine getireceğiz. Her yıl İSPAŞ ve İzmir Büyükşehir Belediyesi işbirliği ile gerçekleştirdiğimiz Travel Turkey Turizm Fuarı başta olmak üzere bölgeye yönelik çalışmalarımızı artırarak sürdüreceğiz. Barışın, kardeşliğin, hoşgörü ve anlayışın şehri İzmir, tüm bu değerlerle büyüyen turizmde de hak ettiği yeri yeniden alacak. Hangi turizm sorusuna vereceği cevapla ülkemizin diğer şehirlerine de örnek olacaktır. Bu bağlamda bize desteklerini esirgemeyen, vizyoner bir bakış açısıyla TÜRSAP ile omuz omuza çalışan, yalnız İzmir için değil tüm Ege bölgesi için büyük katkıları olan Sayın Tunç Soyer'e birliğim ve şahsım adına şükranlarımı sunuyorum. Sözlerimi tamamlarken ülkemiz ve tüm insanlığın güzel ve sağlıklı günlere yeniden kavuşması dileğiyle başarılar diliyor. Hepinizi saygı ve sevgiyle selamlıyorum.
Merhaba. I would like to thank the organizers of this conference, the Izmir Metropolitan Municipality, Infectious Diseases Prevention Association, and the Turkish Society of Clinical Microbiology and Infectious Diseases. SunExpress has been a stable and reliable partner for Turkish tourism for more than 30 years. We have a special partnership with Izmir as one of our main hubs. And I'm here today to speak to you from a travel and tourism perspective. Many things have changed in the last 2 years, and I think we're all happy to finally start getting out of our houses again and meet with people. Many people have had to trade in business travel for virtual meetings, meeting loved ones in person for calls and care packages, substituting movies for Netflix and streaming services. But there are some things that cannot be replaced, like the breeze on the shores of the Aegean Sea, feeling the warm sand of Izmir beaches, or getting a hug from your loved ones and feeling to be at home. The travel industry is among the most impacted by COVID-19. SunExpress has been and will always remain a reliable partner for Turkey and for Izmir specifically. Tourism and travel go hand in hand. We cannot talk about one without the other. And in the following couple of minutes, I want to cover 3 areas with you. The first topic is the travel industry in general. How's it doing? What's going on? And how bad was the impact of COVID-19? The second topic is the path to recovery. And by the time this video will be broadcast, a few more weeks will have passed, and I'm hoping that we'll be well underway in this recovery process. And the third and last item I want to cover are new trends. What's going to change? What's going to stay the same? That's what I want to cover in these next few minutes. Well, let's go into the first one. According to the World Tourism and Travel Council, in 2020, 62 million jobs were lost. Turkey, unfortunately, was affected in line with this development, with revenue down 60% in 2020, down to $12 billion. Tourism constitutes 12% of Turkey's economy, generating foreign currency jobs and highly contributes to Turkey's positive image in the world. The airline industry has lost 2 to 3 years of growth on average, and some studies are even talking about 10 to 12 years in terms of paying back the debt that have been incurred over the last 2 years. SunExpress remains a stable and reliable partner throughout this crisis and after. We have full confidence in the Turkish government to take further steps to retain Turkey's status as a role model for safe tourism and destination. The second topic is the path to recovery. And this is the positive note after all the negative news in the first part. We support local, regional, and international initiatives to nurture tourism and its comeback. The recovery phase for tourism has started while I'm speaking, and again, this is a few weeks earlier than this will be broadcast. IATA expectations for 2021 have been 52% of pre-COVID passenger levels. 2022, they're already expecting 88%, and 2023, it will be back to the levels of 2019 and maybe slightly above. What we are observing is that there's traffic flows the moment borders are reopening, the moment travel restrictions are being lifted. For example, there was a 100% booking spike for the UK to Portugal traffic when the UK green-listed the country back in May. Consumers have saved money during lockdowns. They went out for dinner less, they traveled less, and in some case, this money saved exceeds 10% of the GDP. They're ready. We're ready. And travel is one of the most priority items to do when going back out there. Key factors which are fueling the recovery are obviously the vaccination campaigns, and they're running at full speed. 16% of the Turkish population, almost 50% of the European population have been fully vaccinated with the second shot and 2 weeks after. A huge thank you to the Turkish government for prioritizing tourism employees with the vaccination drive. And we as SunExpress have also participated and benefited from this, with over 70% of our customer-facing employees already having been vaccinated. Countries have started easing travel restrictions. A few days ago, Germany, for example, moved Turkey from the list of high-risk countries to the list of risk countries. That means no more quarantine for everyone fully vaccinated, recovered from COVID, or negatively tested passengers when entering Germany. Turkey proves again to be a rebound country, as it has before. SunExpress has started the summer season on a high note. The first 5 months of the year were not too strong, far away from what we would call a normal season. But Turkey, again, being the rebound country as it is, has shown that it can turn around and that it can pick up the revenue and passenger streams that we've seen in years before. Normally, we have over 150,000 bookings per week. And this was even before the quarantine rules. Now it's become even stronger, and all business units within SunExpress are benefiting from this trend. Yields are positive. People love the fact that they can fly to the country they love. They've spent money and are willing to pay good money for that. If we look at last-minute sales and the timing of their bookings, at the beginning of the year, 75% of total bookings were made 14 days prior to departure. This was 35% during our regular season and before COVID. With the support of flexible products that we've come out with, for example, Sunflex, Corona Care Guarantee Insurance, things that make travel easy again with all the hassles that COVID has put on us. Our short booking curves decreased to 64% in April. And of course, this is still very high compared to pre-pandemic years. With a clear focus on booking holiday flights, 50% of new bookings for July and August are even lower. Bookings and early demand indicators, for example, looking at Google Trends and sunexpress.com, people worldwide are eager to fly, and I think we can all relate to that, being eager to get out there again. Turkey offers great value for money, caters to all types of travelers, whether it's nature lovers, outdoors, beach lovers, great food, warm hospitality, it's all there. The Turkish community outside of Turkey started booking flights in the middle of May. And the last 3 weeks, our demand has been higher than that of 2019. Touristic demand has been strong since the easing of travel regulations last week. So again, this may be 3-4 weeks from now. Bookings rose by 125% in 1 week, 1.5 times stronger than in 2019. Moving Turkey from an EU high-risk country to a risk country is a major, major achievement, and we're very grateful for this. And it's the outcome of the great work in terms of the harsh lockdowns the Turkish government has decided to take. Again, SunExpress is ready to support this rebound through dedication, collaboration, and the warm-hearted spirit of our crew. The third item is what will change in tourism. And everybody's talking about, well, we've gotten used to video calls, FaceTime, Zoom, Teams meetings. And we can see that in business numbers that have gone down. But SunExpress is a company that very much relies on visiting friends and relatives, ethnic travel, families visiting each other. And we also see that that segment has been very stable. The touristic segment, we talked about everybody wants to travel again, is also up. And we're benefiting from an increased demand in safe and short-haul destination, so city travel and city visits. Until we will fully overcome the pandemic, safe tourism will absolutely be key. And the winners will be countries offering safe and hygienic travel with a good value for money ratio. Turkey proved again that it's a unique holiday destination with a safe tourism campaign and extensive hygiene measures. As SunExpress and a key contributor to Turkish tourism, we believe that Turkish tourism will gain considerable momentum and emerge from this crisis stronger. Flexible products offering tailor-made solutions for SunExpress will further boost this. The following options cater to the need of our passengers during the pandemic. You can buy a free middle seat next to you. You can do a Corona Care Guarantee insurance where you and your first-degree family members can change your flight if you are positive and infected by COVID. We also help take the stress and hassle out of filling out all the forms that are required, and we do it for you at the airport online. We've observed a great spirit for innovation in Turkish tourism. Visit İzmir app, for example, is a great example. The Orange Circle certificate, which SunExpress has received for safe and hygienic travel, is another. In closing, let me summarize. The tourism industry went through tough times. And believe me, as a CEO of an airline, having gone through this for the last 15 months, times have been tough. But recovery is on its way, and it is on us to make the most of it. Turkish tourism is strong, flexible, and innovative. The get-up-and-go mentality and culture is unbeaten. We are confident that Turkey will emerge from the pandemic stronger than ever. And looking forward, I also am curious to gain the great insights from the microbiology and disease prevention professionals and listen to you what input and advice you have for our industry. Thank you again to the İzmir Metropolitan Mayor, Tunç Soyer, and to the organizers of this insightful conference. SunExpress connects people's hearts, and discussing safe outlines for future encounters is vital for us as a company and for stable recovery of this country. Hoşça kalın. Thank you very much for having me, and enjoy your conference.
Ladies and gentlemen, dear colleagues, first of all, I would like to thank the İzmir Metropolitan City authorities and all the organizers of this convention for this great opportunity to speak about the way COVID-19 has impacted German and European travel industry and how tourism will recover. As we have all painfully experienced, the COVID-19 pandemic brought very difficult and quite challenging times upon us. Our globalized world became less globalized for already more than 1 year. People stopped going on business trips, and holidaymakers refrained from trips to faraway places and stayed in their backyards. Fortunately, it looks actually like the worst part of this pandemic and its drastic consequences for our entire industry are behind us. Ladies and gentlemen, in order to highlight the effects of the pandemic, please allow me to take you back to the beginning of 2020. Until February of that year, we were quite confident that 2020 would set economic records and everything seemed to be very bright. But then things turned bad. With the first wave of COVID-19, sales plummeted heavily and turnover dropped down by 80 or 90%. Even though German government gave substantial support by the way of funds, of loans, subsidies and employment supplements, the economic situation is difficult to cope with for the most of the professional players within the market. Without doubt, German travel industry has been hit very hard. However, I believe the blow to the tourism segment in many of our partner destinations is even worse and must be crushing. Especially in countries of the developing world, tourism has been a stable provider of income. Now that revenue from tourism has subsided, we were seeing the negative effects. Many families have problems to make ends meet. Schools are being shut because of missing tax revenues, and even wildlife is under pressure due to a new surge in poaching. There is just one positive thing we can mention about COVID-19 when it comes to tourism. Without the pandemic, we would never have estimated the worth of our enterprise. Obviously, there have been facts and figures around stating the tourism is one of the major economic drivers. But we have never had to witness that what a hard impact the breakdown of tourism has on everyday's life. How many people's livelihood are depending on this source of income. Full recovery will still take some time, no doubt. The year 2021 will be another challenging year for our industry economically. And this not least because of the first half of the year is largely lost due to the de facto shutdown of the national and international travel activities. But we were seeing some light at the end of the COVID-19 tunnel. We are actually seeing in the last couple of weeks a lot of progress. Especially the Mediterranean seafront will see the return of many German holidaymakers this year. Turkey will certainly profit from that rollback. We are all very happy and pleased that Turkey is not longer listed as a risk destination by the German Foreign Office. This has already and will continue to have a significantly stimulate bookings to the various Turkish destinations. As you are aware of, Turkey is very popular with Germans. In summer 2019, Turkey was number 2 in the favor of the holidaymakers after Spain. In the current bookings received for the summer 2021, Turkey is in the 3rd place behind Greece and Spain, but actually very much catching up. However, it must be taken into account that the total bookings within the German source markets are still way below the average of a regular summer. We are pleased to see that the demand for holidays has not subsided. It is actually the other way around. People are, after all the restrictions of the last year, in a real need of a break, especially families with children, many of whom could not go for months to school or to kindergarten. People long for a holiday the way they used to spend their holidays. As the vaccination process increases momentum with a coherent testing strategy implemented and hygiene and safety measures in place, that will also be reflected in booking numbers. Turkey, as one of the all-time favorite holiday destinations, will definitely be back. The question is, will tourism be the same compared to our pre-COVID-19 industry? Will the way we view tourism change, or might we even witness a totally new tourism altogether? Unfortunately, I'm, as you are, not in possession of a magic crystal ball and able to glimpse into the future. But I can draw up a likely scenario. First of all, you should not believe that tourism is a stable, immobile phenomenon. The opposite is the case. Tourism products have even changing all the while. The same is true for tourism industry. New innovative companies constantly are appearing. And I personally believe that our industry will get even more dynamic than we used to have in the past. The pace of change and innovation will increase, and the tourism portfolio will expand even further. Companies are under pressure to optimize their products, their internal processes, and their market access. The price tag will stay important, no doubts about that. But price is, in many cases, far from being the key factor to customers. Individualization is. We are going to see that the products on offer will become even more tailored to the customer's wishes. Remember mass tourism in the 70s and 80s. Very uniformed hotels catering the needs of a quite uniform holidaymakers. People from very strangers, blue-collar jobs in factories, wanting to relax at the beach. The jobs have changed, so have the ways people view their holidays. We need to have that in mind. What will we see on people's wish list? My answer would be authenticity, activity, and sustainability. Holidaymakers care about social and environmental standards, want to feel that they are having a positive impact to the destination, to the people. For the obvious reasons, people will be more aware of safety and health issues following the COVID-19 pandemic. Obviously, we are all hoping that the vaccination will be able to counter COVID-19 effectively, and we will be back to a so-called new normal. As with a risk and the tweets in our global world, holidaymakers will realize that in our globalized world, there is no way to shut an infection out. People will have to watch out for themselves, make precautions, and be considerate to others, regardless in what part of the world they are spending their time. We will come to accept and to live the disease as good as we all can. Travel industry has made a lot of concessions to keep travel and holidays safe. I'm quite positive that we will manage to minimize the risk for our customers, for our clients, for the holiday makers and the business travelers alike. We are recovering. It will take some time, but I'm quite sure we will get there. The German travel industry knows that we can rely on its Turkish counterparts, on our Turkish friends and long-lasting partners. The Turkish tourism product is of high quality and value. German holidaymakers who have been to Turkey know and keep returning. It's up to us to get things going again. Let's roll up our sleeves and see to it that we get tourism's engine up and running again. Thank you very much.
Hello and welcome. My name is Terry Dale and I'm the President and CEO of the United States Tour Operators Association based in New York City. It's a real pleasure for me to join you today. So what I want to share with you is our vision. We at USTOA are a community of leaders working to make the world a better place to travel. And I think that is so admirable. We all need to leave this earth in a better shape than we found it originally. So currently, USTOA has 49 active members. Those 49 active members own and operate 145 tour operator brands. And then we have over 650 associate members, of which you are one of those. And we totally applaud your support and we appreciate that. We have 57 of our brands who currently have product going to Turkey. And these are some of the iconic brands that are going to Turkey today. So I did want to share with you a personal story. When I first took this job at USTOA a decade ago, I had never been on a tour. So my board of directors said, you pick any place in the world that you would like to go, and we will make sure you get there and have an amazing experience. So I picked Turkey. Turkey was the place that I had always longed to go to, and I hadn't yet gotten to. So I spent 12 days traveling your country, and I have to say, to this day, it remains one of my cherished spots in this earth. Now, I traveled with Globus, who is one of our active members. I had local experiences, like a local shave, which was amazing. And I met with icons of the Turkey tourism industry, and we all miss her, I know. But it was just an extraordinary experience a decade ago. So what's important for me to share is that we are unique at USTOA because we have the $1 Million Travelers Assistance Program, which requires each of our active members to post $1 million, whether it's in a bond or a letter of credit or a treasury note that we hold at USTOA. If they should cease operations, the customer can come to us and we would work with them to refund a deposit that they may have had on hold with that particular company. So this is a very unique program to instill consumer confidence. When you travel with a USTOA member, you should feel confident that we are going to deliver on our promise and our brand. So currently we have 11 associate members in Turkey, and these are some of the names who are part of our USTOA family, and we thank you for your support. Every other year, we do economic impact study with PwC, and I want to share some of those stats with you now. First of all, we learned that we are a $19 billion industry. We also know that we take roughly 9.5 million US travelers to every corner of the world. And our members purchase over $13 billion in goods and services. That equates to 21 million hotel room nights and almost 6 million airline seats. And the majority of that transaction goes through the travel advisor. And they continue to be a critical part of our business model at USTOA. So if we look at 2020, and as we know, it was a challenging year. So this was before the pandemic broke. Half of our companies said that they were doing business the second half of 2020, which I think speaks volumes about our ability to be agile, our ability to pivot. We knew that domestic was going to drive any travel at the end of last year. So that's what our members adapted to. And of course, the challenges trying to understand the different quarantine restrictions, coordination of protocols, and limited availability of rapid testing. So what we also learned is that 33% of our customers who traveled with us last year said that the new wellness protocols did not hinder their overall travel experience. And that's significant. And we did have half of our members requiring our guests to sign a health disclosure acknowledging COVID-19 and whether they had been tested or whether they had actually experienced the virus. So when we asked our travelers, what are they looking for? Obviously, the cancellation and refund policy is top of mind, health protocols, and of course, insurance policies. And when we look at where they're going, currently, 65% are still going international, and 35% are staying within North America. Now, when we talk about future confidence for this year, 69% are confident or highly confident that guest bookings will increase in 2021. And 90% express some form of optimism about the resumption of business and travel in 2021. And we are clearly seeing signs of that today. And when we talk about the travel advisor, which I mentioned briefly before, 88% of our members plan to utilize travel advisors to generate sales, and 72% of members expect business booked by advisors to increase or remain the same in 2021. They continue to be key to our success. And if we look at the different types of products that are being offered, top of the list, small group tours, followed by private groups and FIT. And then you also see river cruising, small ship cruising, classic group tours of 25 plus passengers, as well as ocean cruising, rounding out the list. And then, of course, when we talk about trends for 2021, top of mind is always safety and wellness, border reopening, distance and ease of travel to and from the destination, value, and certainly outdoor travel is part of the equation. If we talk about threats to travel in 21, Our members tell us that, of course, pandemics or other health crises, that's a threat, a potential recession, or global financial instability also is something that weighs heavily on our mind. So, 87% of Americans today have travel plans in the next 6 months. And I think that bodes extremely well for Turkey. And March 26th, Turkey and Greece were named the hottest destinations for this summer travel season. And I sure hope that that bodes and bears out later this summer travel season. So obviously there are some principles to safely restoring travel. This comes from WTTC, and it's really looking for a coordinated approach in the EU. We have to shift to individual traveler risk assessment, country by country, which is key. And we need to reinforce our health and hygiene protocols as we open up travel globally. So I'd just like to end by saying we have such a long history of partnership with Turkey and USTOA, and we know that that means growth. And we all need that, obviously, in this environment. And we thank you for that partnership, and we look forward to many successful years moving forward. So thank you so much, and have a great conference.
Thank you, Mr. Tunç, for the invitation to the Izmir World Pandemic Conference. Slow Food knows how much you are devoted to developing solutions that help the world to improve after the pandemic. Since the outbreak of the coronavirus, Slow Food has been vocal about the likely role played by industrial agriculture and the disruption of ecosystems in the emergence of coronavirus. The measures taken to slow down the spread of the virus have had an adverse impact on global food chains, both short and long. Travel restrictions have prevented seasonal workers from reaching the fields, putting entire harvests at risk. Exports restrictions introduced in a few countries are halting crucial flow of staple foods. As an example, when Vietnam suspended its rice export, Malaysia was left with only 2.5 months of rice supply, raising risk of increased food insecurity. The COVID-19 pandemic is deeply increasing already existing inequalities. Before the pandemic broke out, 820 million people worldwide were undernourished, and 2 billion people experienced food insecurity. A report by FAO, the World Food Programme, and 14 other organizations warned that the coronavirus crisis will have a dramatic impact on the access of vulnerable populations to food and the availability of food, and on the household's income, which are likely to contribute to pushing more than 250 million people to the brink of starvation. On the other hand, the COVID-19 crisis is uncovering the strong resilience of local food systems, the adaptability of small-scale producers, food artisans and cooks, and the incredible power of communities. We have witnessed amazing acts of solidarity across the world in small and big communities. The city of Izmir was in the front line of such acts of solidarity. Slow Food urges decision makers to start building the foundation for sustainable food systems and not to restore to business as usual solutions in response to the COVID-19 crisis. This is true also for the tourist sector. As world tourism begins recovering from the coronavirus crisis, we have to place destination needs at the center of tourism. As the Future of Tourism Alliance puts it down, decades of unfettered growth in travel have put the world's treasured places at risk, environmentally, culturally, socially, and financially. Now, the tourism industry faces a precarious and uncertain future. Recentering around sustainability is key for long-term, deep-rooted growth. This is why Slow Food has launched a new project named Slow Food Travel. From a gastronomic perspective, we are aware that tourism and the food sector do not interact as they should and could. On the one hand, this reduces the possibility of tourism having a positive multiplier effect on the high-quality artisan food production of a given destination. On the other hand, it often jeopardizes the opportunity offered by a local gastronomic heritage to truly contribute to building a tourism product that is truly unique and not replicable. So what does it mean, slow food travel? It means building a destination where quality food and tourism interact in the best way possible. This means building menus and breakfast in hotels and restaurants that truly incorporate the local products that are traditional, typical, and artisanal, and that give visibility to those products and producers in the menus and breakfast. This also means working with the stakeholders of the food sector, whether restaurants, hotels, or producers, to be able to develop out of their unique food heritage, unique food tourism experiences. Food tourism is growing exponentially. Once considered to be of interest to only a few, or possibly even elitist by some, today the appreciation and search for good food and drink is fully mainstream, with 53% of leisure travelers choosing their next destination because of food and drink. This is stunning figures. Emerging trends show also that people are likely to travel as they were in the past, possibly even more. Yet, people have also changed their gaze on what they expect along their journey. You see, we have been stuck in our homes and towns for so long, drifted away from our real lives, often forced to spend a great part of our day in front of a screen, interacting via Zoom, Teams, or Skype. People have hunger for the real life, true experiences delivered by authentic people. Our small-scale farmers, artisan food producers and chefs, the communities behind them across the globe, represent the guardians of a unique food heritage that they truly live in their everyday work. This is exactly that authenticity that tourists search for more and more. Slow Food is here to help precisely to develop this potential in the most sustainable way. 4 years since the launch of Slow Food Travel, results are very encouraging. In our first destination launched in Austria 4 years ago, last year in 2020, the number of tourist nights has increased by 30% compared to 2019. This is a stunning figure. Of course, it is not only the merit of Slow Food. It was also thanks to many other factors, but yet it is very encouraging to us. It is an encouraging sign that we should continue along the path we have taken. Today we have 11 destinations available in 3 countries, Italy, Switzerland, and Austria, but we are growing fast, and new destinations are expected to be launched this year in Austria, Azerbaijan, and Ecuador. Who knows, maybe we will be working soon to have our first Slow Food Travel destination in Turkey as well. Why not? In the Aegean coastal region. One last consideration, a cross-cutting one. The pandemic has outlined how communities matter in building our resilience to shocks such as that of COVID-19. In the past years, we have been increasingly induced by social media, internet, our lifestyles to interact just with like-minded people, often dislocated everywhere in the world. But we had forgotten who are our neighbors. We could ignore who they were. The pandemic has taught us the importance of relations of proximity, of solidarity with each other. In a nutshell, it has placed again the community we live in at the center of our world. We shall keep this lesson and dedicate time and resources to nurture our communities. In a world where it is increasingly difficult to read the world around us, to talk with each other, to understand what's real from what's fake, the community is a model that can give us the strength and solidity to thrive as individuals and as societies. At Slow Food, we have always believed in the power of communities, and Mayor Tunç knows this very well too. This is why it has always been very easy to cooperate with him and his administration. He knows the importance of building ties and connection across our communities to make our communities more resilient and sustainable. So thank you very much. I will follow the other interventions with great interest. Çok teşekkür ederim. Thank you and bye.
Your Excellency, the Mayor of İzmir Metropolitan Municipality, Mr. Tunç Soyer, distinguished dignitaries, speakers, delegates, my friends from the travel and tourism industry, ladies and gentlemen, I am truly delighted to join the World Pandemic Conference organized by the city of İzmir, which also has a section that focuses on travel and tourism. I must compliment the organizers because it's a great cause. I represent UFTA. Please allow me to briefly refer to UFTA, United Federation of Travel Agents Association. We are a 55-year-old global federation of national associations and are represented in over 70 countries. We are truly delighted that our Golden Jubilee World Congress was hosted in your most beautiful country, Turkey, in the magnificent city of Istanbul. TURSAP is an important and favorite National Association member of UFTA. TURSAP, with over 12,000 members, is UFTA's largest member association. It is outstandingly led by the most dynamic president, Mr. Firuz Baglikaya, who's a very popular speaker in UFTA as well. UFTA's role in tourism is very vast and is ably supported by TURSAP. Mr. Setin Gursun, who had served as the Secretary General of TURSAP, is now the Vice President of Tourism in UFTA. UFTA brings heartiest compliments to the Mayor of İzmir, Your Excellency, Mr. Tunç Soyer, for this most outstanding event, which is very rich in content. Your Excellency, we at UFTA are highly appreciative of your leadership to the tourism sector for a very long time. And we are very confident that you will enhance the potential of visitors to Turkey in general and İzmir in particular. I must mention that I was fascinated to read about İzmir, a destination that travelers, in my opinion, must include always in their itinerary. It is very rich in amazing history, unique culture, fantastic gastronomy, incredible sceneries, so much of beauty and wonder, and indeed a paradise to experience. Your Excellency, at UFTA, we shall certainly try and promote İzmir, or slow city metropole. People living here and visitors are gifted with clean, green, and most friendly environment. Wow, what a fantastic place. Dear friends, my presentation today will focus on the impact of the pandemic briefly, tourism beyond the new normal, tourism expectations, and the destination preferences for tourists to choose from. I shall be very quick and short. The impact. According to WTTC, prior to the pandemic, 1 in 4 of all new jobs in this world was in travel and tourism industry. We actually accounted for 10.6% of all the jobs in the world. Travel and tourism also accounted for about 10.4% of global GDP, which is $9.2 trillion, and this is in 2019. What happened in 2020? Came the pandemic, and the industry suffered a huge loss, almost US $4.5 trillion in losses or in reductions from the previous records. In 2020, 62 million jobs were lost. Domestic visitor spending decreased by 45%. International spending declined by an unprecedented 69.4%. I can go on and give you more statistics, but this is adequate for us to appreciate the size and contribution of this most fascinating industry, which must be brought back to its 2019 levels very soon and then scale up to new levels. So there's a very huge responsibility on the governments, on different nations of the world, and everyone connected as stakeholders in travel and tourism industry to strive to get the industry back as soon as we can to our 2019 levels. When we talk about tourism beyond the new normal, first let us interpret what the pandemic did to our industry. It caused chaos, it caused fear, disruption, brought about uncertainty among travelers, which resulted in people staying back or not traveling as they did before. They were always worried about coping with uncertainty. While this negative impact did bring about a global crisis in many industries, travel and tourism industry took a bigger hit, either in the area of travel, tourism, hospitality, or MICE. The pandemic took away the sheen or the luster of the tourism industry. Tourism was the best form of leisure. You know, you talk about leisure, and tourism was the best form of leisure that people looked forward to. If you want to try and interpret the word leisure, it represents freedom, relaxation, holiday, or vacation, joy, and more. Like our basic or physiological needs, tourism became an important need for people because leisure offered them to get away and celebrate the experience. This getaway with a lot of excitement, a lot of fun, offering reunion, discovery, gastronomy for those ardent travelers. Well, life without periodic leisure is very difficult to live. Now, the big question is, what next? Travel, tourism, culture, and gastronomy during the pandemic has certainly taken a big hit. The world has been asking many questions. How long can this big hit last? When will the world get back closer to normalcy? When will tourism open up again? Will people travel in groups as they did before? Will they opt for longer duration travel? Somebody traveling for 2 weeks, 3 weeks, do you think it will happen again? Now we are confronted with these questions which have a lot of answers. Everyone's trying to give their own response. But in my opinion, and my colleagues in UFTA, we all believe that we need to redesign these questions. The challenge before us is how quickly can we overcome the negative impact and move forward. So the question should now be, what can we offer to support people overcome fear of travel? There's a big fear of travel. So what can we offer to support people overcome this fear? How soon can we create comfort zones for tourists? You know, you need to extend hand-holding. That'll give tourists a lot of comfort. How soon can we create these comfort zones so that tourists will start moving out? What innovative approaches must be launched into to attract people to travel and get back to leisure? I think we need to start looking at a new normal followed by the next normal. And the next normal must be packed with a lot of innovative approaches. And that's our challenge. How ready are we to bring in more technology to blend with tourism? Because now tourism is not just an opportunity to travel, it's got balancing aspects. One aspect, the health and environment, and the other aspect, it's got to be driven by technology, a lot more technology than it did before. Because the tourism expectations are growing by size. Tourism, in our opinion, is expected to come back. When you talk about how soon, we would say in 2022, during 2022, we may get closer to the 2019 numbers. Maybe in 2023, we may match these numbers and start overtaking them. Unless we are impacted by another spike, the world cannot afford another spike in the pandemic. And this is a very underlying point that I wish to make. Tourism, ladies and gentlemen, now a new norm has set in. And the new norm is that people must start believing tourism will be more expensive than it was before. Of course, since transport, air travel costs, hospitality costs, F&B, cost of related services, all of them have taken a bigger load of the negative impact. Now everyone's going to try to come back to sustainability, and they will be available at a higher price. But then it needs to be offered to tourists as a package that is much safer, secure, and more carefully designed. So we need to build in a lot of value. When you're asking more money, obviously you have to add a lot of value into tourism. We see large groups. I'm giving you an example. Large groups in family and friends. Well, this is a travel that has sized down extensively today. Now, will it happen? We see large families, groups of friends, partying together, traveling together, celebrating occasions together. Now, we need those groups very badly. But then they can only happen when they are backed up with a lot of hand-holding by the destinations. The numbers today are smaller, and the duration of the tour is also shortened. This is one important aspect that we must acknowledge. Somebody was ready to travel for 2-3 weeks, even a month. But today people are conscious of making the travel shorter, come back to base, and then go again. What kind of destination preferences will tourists be looking at? This is an important question. Tourists are expecting destinations to offer more safety and security, particularly emergency services, easier health protocols. A lot of governments are coming up with protocols. They have to be user-friendly, easier health protocols, more facility at their command, and much better hand-holding. Technology will play an important role. There is a need for many more apps to get introduced to turn up on tourist smartphones with a 24/7 assistance. The app can be their all-time guide and keep them connected every time. So you're traveling, you will have a map which is like your all-time guide. And that map, that particular app can make your life easy. Destinations that reflect care and concern will also be preferred. Media today plays a very big role, and media will continue to play the big role in promoting destinations that are not impacted much with the pandemic. One can't opt for a destination where the cases spike often. This is an area that the local governments must be conscious about. So if you want to promote a destination, make sure the pandemic's impact is the minimal or not there at all. Having said all of this, I must mention there is an urgent need, a high priority need for the governments to work together to team up if you want tourism to be promoted well. There must be uniform and friendly global health protocols that must encourage more tourism. If your protocol is difficult, impossible to achieve, or making it so complex that people would run away, stay at home rather than taking a getaway, then tourism is getting affected. Surely the government must take care to ensure that there's no inflow of the pandemic into the country. But then that can be done in many more ways which can appear and which are friendly to the tourists. This is one area that the world is certainly concerned about. Now, UFTA is publishing a promotion on vaccine equity. We are talking about vaccine equity. Very soon we have our General Assembly. We will be promoting resolutions, asking governments for friendly protocols to be put into practice, less of discrimination. Without this, tourism will be a challenge as an industry and as an opportunity for the discerning traveler. In conclusion, my dear friends, allow me to say that the times ahead will be a new norm to live and cope with. We have to learn to live and grow with such situations. I always keep telling myself and a lot of my friends that each one of us in our own living must prove to be superior to circumstance. So this kind of an environment certainly is challenging, but it comes with opportunities as well. This is what life is now teaching all of us. Those who can cope up and move fast will make it big. The first mover advantage is offered to the hundreds, thousands, or even millions who are ready to plunge into offering a better world for the purposes of promoting much more tourism. I'm quite certain that by the end of this conference, the organizers, led by His Excellency the Mayor and supported well by Tour Saab, they will come out with some kind of a global directive that can assist nations, countries, organizations like UFTA, work in tandem with WTO, and then make it more user-friendly for tourism to succeed, and then very soon try and achieve the numbers that we had in 2019. Our goal is not just to achieve the 2019 numbers. Our goal is to get back to normalcy, go beyond these numbers, and that is where we have to start designing the next normal. All the very best. Congratulations once again, and thank you very much.
We thank very much Mr. Bağlıkaya, Mr. Kaunatsky, Mr. Norbert, Mr. Dale, Mr. Rumiz and Mr. Kumar for their speeches. With the pandemic, we started to use Marshall McLuhan's famous concept of global village again. So now, let's start our fourth session about global fight with the pandemic. This session will be held by dear Professor Walter Riccardi, the President of World Federation of Public Health Associations. Dear Professor Bettina Borish, the Executive Director of World Federation of Public Health Associations. And dear Helen Yang, the Head of Investor Relations of Sinovac BioNTech.
On behalf of the World Federation of Public On behalf of the World Federation of Public Health Association, it's a pleasure for me to give you a warm welcome. And I know that Professor Bettina Borish, Executive Director of the World Federation, will speak more precisely on the challenges that the global pandemic has posed to the world. I only want to say that the World Federation has engaged during these years in several activities working with national associations to take advantage of the experience that we had during this past year. Personally, as maybe you know, I am from Italy, and I am the scientific counselor to the Italian Minister of Health. So we were the first country to be struck outside China in February 2020. And I can tell you that we had very difficult times. At that time, it was really impossible to think about a full lockdown of the whole country for 2 months. And this is the message that we want to give you. Don't hesitate to take tough measures when you engage. Of course, you have to take non-pharmacological, such as lockdown, quarantine, isolation, limitation of the mobility. Now we have a vaccine. The combination of the two is the only key to face such a situation. In the future, we have to be prepared, and I fully believe that a global pandemic treaty will be very important for this, and that we have to support WHO and United Nations to develop such a global pandemic treaty, because this is a challenge that we can win only at international level. There is no single member country of the world that can really fight successfully this pandemic. We have to be prepared in the same time, all the world together, and the non-pharmacological and pharmacological measures together are the only way to go on in this direction. So thank you very much, and I hand over to Professor Bettina Borish.
Dear colleagues in Izmir and far beyond, Mayor of Izmir, colleagues and professors who are listening, a good, warm welcome. My name is Bettina Borish, and I'm honored to be invited to your Congress in Izmir that will really go about the pandemic we are still struggling with. I have given my talk the name Global Struggle with the Pandemic because I think that we are still struggling in all parts of the world with the ongoing COVID pandemic. I am here with you as the CEO of the World Federation of Public Health Associations, the umbrella organization of all national public health associations, but I'm also here as a professor of global public health of the University of Geneva. So thank you for being invited to Izmir. I would have loved to be there in person with you, but as we all know, it's not yet possible. That's why I'm looking forward to see Izmir one day, as it is a healthy city and part of the Healthy Cities Network. But I would like to send my warmest greetings from Geneva, the lake, to Izmir on the sea. We had in Geneva last week the visit of Vladimir Putin and Joe Biden. So they choose our little city to have a political talk, whereas you choose the beautiful city of Izmir, much bigger, much more important, second most important harbor in Turkey, to have your conference held virtually and perhaps also in person. As I told you, I'm here as the representative of the World Federation of Public Health Associations, and I would like to convey the greetings of our board, our presidents, the past, the present, and the elected ones. And also, due to my function as a professor at the University of Geneva, I can tell you that the World Federation is headquartered in Geneva within the Institute of Global Health at the University of Geneva. So you see, we are close to WHO, we are close to global health here, and that's why I would like to share some of the ideas with you. You will talk tomorrow and after tomorrow about the societal impact of pandemics in general. And since the pandemic, everybody knows now that health, when it's not okay, has direct, immediate impact, technically, economically, medically, but also politically. And what we do not yet know, and we will see with the ongoing pandemic, what will be the long-lasting consequences. They will unfold only years or decades later. But before we go, let me take you to a beautiful place, not far away from Geneva. What do you think where it is? Looks sunny, looks nice, and you see this wall, a stone wall, a dry stone wall. Well, this place is in the south of France, a place close to Marseille. And what you see is a 27 kilometers long stone wall that had at regular intervals sentry boxes where soldiers could stand and wait. What was it? Yes, this is what we call the Mur de la Peste, the wall of the plague, and that was built during the last big wave of the plague that went from Marseille further. The idea was, if we build a wall, we can limit the spread of the disease. And if we have the wall very, very well kept with soldiers and nobody trespassing, we will confine it to Marseille. As you all know, it didn't work out like this. The pest came all over Europe. And the consequences of the pest or the Black Death immediately were important. There were border controls. You tried to delimitate, like with this wall. There were restrictions of movements of persons and goods. There was the introduction of what we still call nowadays quarantaine, 40 giorni, from the Italian word, because it was also used in Venice. And there were rules for waste management and rituals that had to be changed if you wanted to bury a person. Also came directly with the Black Death, the othering. It's not us, it's the others who brought the disease. There must be someone else. A lot of conspiracy theories at those days went against the Jewish population. And there were, it looks like nowadays, the appearance of some fanatics. They were called the flagellants, people that went around Europe, I'll show you. And like today, there was the introduction of PPE, personal protective equipment, for the health workers, especially to protect them from getting the Black Death. And a little thing that nobody knows is the kind of summer holidays were born that we know now, because people knew if you go out of the big cities in a villa, then you are protected. Here, the good sign flag for quarantine that we still use nowadays. And here you see the personal protective equipment of those times. Doesn't look exactly how our masks and shields, but they had to be protected as we have when we have health workers. And on the other side, you see the flagellants, people who walked around Europe, beating up themselves and claiming that this way they could get rid of the disease, the spread of the plague. Now, we had a lot of impact of the Black Death. A lot of people died, 25 million. That was reducing the population of Europe almost by 2/3. Then there were no people who were doing the work in the fields. So the labor became more important. People had to pay more for people working on the fields. And there was a general rise in wages for peasants and artisans. So finally, at the long, long run, there was a change in the society, and there were more fluidity than in the aristocratic times before the Black Death. Now we have COVID. COVID, we have directly the information and very fast what kind of disease, what kind of virus, the disease we are learning every day a bit more, But the virus was identified quickly, but unfortunately, as quickly as that, it moved around the world. And as you rightly said, with the theme of the first day, it's a global struggle. We all have to deal with it. And like in the Black Death times today, we have direct impacts on the economy, the health systems, the political system. We had to restrict traveling of persons and goods. We had quarantine-like regulations in several countries. We still have economic consequences because we are suffering the largest global recession in history. And we do have conspiracy theories, and people think it were those or the others who brought it. And far more importantly, now we have a threat to multilateralism. We have been used to be together and exchange, but this looks very much under threat now. And we see also that the pandemic may clearly intensify gender inequality and other pre-existing inequalities. We wonder if we have to work up the international health regulations because they were set up to be there in such a case like the pandemic. But a lot of countries didn't follow and didn't have the things in place that they should have. So yes, there's a global impact. It's a global, and it needs a global pandemic strategy and work. We only can make it together. I think we should have learned it. If we have not, we should learn it now. And as the Director General of the WHO, Dr. Tedros, says sometimes, no one of us are safe until all of us are safe. So we know that all health systems have been stressed and tested. It was a stress test for us in all our systems. And I think as every country did it on its own way, a bit separate, we can learn from each other the positive lessons, but we should do learning and not competition. For example, also now we are in the phase of the vaccination rollout strategies in different countries. Again, there, very different strategies prevail. We have seen important vaccine nationalism, and that is detrimental. We have to combat this vaccine nationalism. This is a very difficult task. And what we will have to do at the long run, we have to strengthen our healthcare systems and also social systems, because only a strong system can resist and show the resilience needed for a next upcoming pandemic. This reaction, me first, I have to protect my first, or my country first, is a normal human reaction. And I can understand the reaction very well. It was in Switzerland, I don't know how it was in Turkey, at the beginning of the first wave, a hoarding. People went out and bought toilet paper or also disinfectant, like here, hand disinfectant. But you can learn that even if you have bought up the last 27 bottles of disinfectant for you and your family, in the house where you live, it's of no worse if you have it all, if your neighbors don't have it. They will touch the lift, some places, and so you can only be safe when the others are safe also. So the hoarding for one doesn't help. The hoarding for one country doesn't help. And it's shown in this cartoon where we, in fact, if we think of it, know that we are in one boat. And these people saying in German, happily and luckily, the whole is not on our side. they haven't understood the message. Only together we can come out of the pandemic. Another problem that we do have with this pandemic is the accompanying infodemic. Almost as viral as the virus are the messages that go around. Infodemic means too many information, both correct one and incorrect and fake ones. To combat this, we have now very special educational tools and try to do it as best as we can, but it has to be taken into account during the struggling with the pandemic because it influences people's behavior and population's health. Infodemic is as bad for your health as the pandemic itself. And to close, I would like to say that we are what German sociologist Beck once said, in a cosmopolitan moment, because we all understood that we are in a global space of threat and we are all threatened. Maybe that there is an enlightenment function of global risk and that we will try to get new rules, new powers, new institutions, because we see the ones we had were not as effective as they should have been. Perhaps the pandemic could be a portal, a gateway from the old to the new. With this being said, I would like to thank you for your attention, and I wish you a great Congress and hopefully good discussions. Thank you.
Dear Mayor of Izmir, thank you for inviting me to join in this Izmir World Pandemic Conference. I am Helen Yang, Chief Business Officer of Sinovac. Sinovac is a company focusing on research, development, manufacturing, and supply of human vaccines. And our mission is to supply vaccines to eliminate human diseases. And now we understand the whole world is facing the pandemic of COVID-19. And Sinovac is one of the front runner to develop a COVID-19 vaccine and supply to the world. Until now, Sinovac has already completed preclinical studies as well as human clinical trials in China as well as in the world. We have conducted the phase 3 trials in Turkey, in Brazil, Indonesia, as well as in Chile. So overall, over 30,000 volunteers has participated into the phase 3 trials for the COVID-19 vaccine developed by Sinovac. And I would like to take this opportunity to express our gratitude to all the scientists and volunteers from Turkey who joined on this program, who is contributing to this study as well as to contributing to the public health solution to prevent COVID-19 vaccine for the world. And now Sinovac has already in the process of supplying vaccines to the world. Starting from last year, we have set up the big amount of manufacturing facility, which will provide us the capability to supply up to 2 billion doses of COVID-19 vaccine to the world. And Turkey is one of the strategic important country for Sinovac. We have supplied millions of products through our partners, KLİMİK, into Turkey. And overall, we have supplied over 700 million doses of COVID-19 vaccine to the world. And over 500 million doses of Sinovac's vaccine has been inoculated in the world. And until now, we have seen that the safety of the vaccine has been fully demonstrated. And together with the phase 3 study results, as well as the real-world study, which is obtained from the rollout of vaccination, we have seen a very strong efficacy results of Sinovac's vaccine. And after using the vaccine in large scale, we have observed the dramatic decrease in the hospitalized cases, fatal cases, as well as the severe cases caused by COVID-19 vaccine. We have seen that the study being run in Brazil as well as in Chile, So until now, Sinovac has already obtained the emergency use approval or conditional marketing authorization from 48 countries or regions. And also WHO gave us the approval for list the vaccine into the emergency use listing. We believe that this gives us a chance to provide our vaccines to more countries. Because through the rollout of our vaccination in the countries where they have started to use the vaccine, we have observed the significant decrease in the hospitalized cases or severe cases or even the fatal cases caused by the COVID-19 vaccine. There was a study in Brazil that the entire town received the COVID-19 vaccine from Sinovac. And we can clearly see the big difference in the people living in that town, that they can live like a normal, which is very different from the surrounding cities and towns where Brazil is still currently with a very high epidemic situation. And similar kind of results was also reported in Turkey, that after several million of people using the vaccine, the reported cases or reported hospitalized cases were dramatically decreased. So we have observed the effectiveness of using this vaccine, and this gives us the confidence of keep doing more on developing and deploying this vaccine to the world. Actually, on the June the 1st, 2021, after WHO grant the emergency use listing for Sinovac, we think this will provide us the opportunity to share our vaccines with even more countries. Until now, we have shipped our vaccine to close to 40 countries, and our aim is to share the vaccine to even 50 countries or even 70 countries. I believe vaccination is related to public health. Only when the vaccination coverage can reach a certain point, which can help to build the immunity herd, then we can see the real change or real impact from using the vaccines. And that is also the time when we can see the pandemic can be stopped. So I believe that Sinovac is one of the team is working very hard about research development, and also right now is maintaining the big supply of the products through gathering the resources of raw materials and trying to balancing and speed up the process of supplying our vaccines in China as well as in the world. And we think that this is not the end of the story. And this pandemic gives us a lesson about how the world should work together in order to provide the collaboration to really give a solution to the world. And in the future, even though we don't want to have this pandemic happen again, but we urge that everyone in the world should be ready even if there will be another pandemic. That's why we have Sinovac actually become a China center for the BRICS country, which are focusing on the vaccine partnership. And this is not only related to the BRIC countries, but also to the more countries beyond these 5 countries, like what we did with Brazil, with Turkey, with Chile, as well as Indonesia. We aim to collaborate more on the research and development and also industrialization of vaccine products. And we also urge trying to work more with different countries to increase and upgrade the vaccine research and development capability in more countries, so everyone can be ready if there is another pandemic to come. So now we also would like to call for a global partnership, and we want to call for all the scientists to joining us on vaccine development. And also we would like to share our capabilities with countries who need it in time, that we can build the R&D capability as well as vaccine manufacturing capability. So in the future, if there is another pandemic to come again, everyone will be ready. So again, I want to thank everyone from Turkey to contribute to the vaccine research and development for the COVID-19 vaccine. I think this is not only for Sinovac, not only for Turkey, this is a great contribution to the world. Thank you.